I'd like to know who I'm talking to first before I even introduce myself. So if you're a dentist in the room, if you'd raise your hand. I know a couple of y'all. Okay, back in the back. That's good. There's a bunch of dentists. If you're a chiropractic or if you're a naturopath, MD, no, okay. Yeah, okay, good. That's helpful for me. So the most of y'all are dentists. Don't shoot me if you've never heard this stuff before and it's new to you. And you guys that are old hat over there, fine. You can critique me and write your notes afterwards. This particular class is about EAV. And what I wanted to do first was kind of give you an idea of who it is that is sitting in front of you. I'm a this is the way it is kind of person. I want you to know that this is my opinion. You will find that I am very opinionated, and I really am a redhead. That makes me very opinionated. I'm very quick to temper. I process things and then come back to it later, but I am very stubborn. I started in a conventional world, which means that I started like most of you all. And it was really very eye-opening to me to think that I went to a state-run university that lied to me, because now I had information that was different. Medicine and dentistry changes. I do believe in prayer, but I can't explain to you how it happens. I can't even explain to you how my cell phone works. So there's a lot of stuff that I use technology-wise, but I'm not very good about explaining it. This is me. I am the executive director of the International Academy of Biological Dentistry and Medicine. That's a mouthful. I'm also a member of the IAOMT, which is a different organization. One is very good about teaching you the science, and one is very strong-minded about the energy, which is why I kind of morphed over to that organization and help run it. I am also a PhD in integrative medicine. I am a board-certified naturopath, but it doesn't do me any good in Texas because we don't have licensure. I am a certified homeopath. I am a licensed paramedic because that was part of my journey. I'm a licensed dental hygienist. That's where I started. And I'm also a certified clinical thermographer because I use that in my private practice. You'll also see some random pictures throughout of my pets through time. I was appointed to the State Board of Dental Examiners back in 1982, which is a really long time ago. I have a bird rescue, so you see some of my birds in here. I have taught at many institutions through the years, and so I won't run through all of them. You can see them on here, and because it's going to be videotaped, if you're interested, you could go back. I am published. The most recent book is this one. This book was my thesis work, compounded with the fact that I was doing EAV at the time, and there was no book to teach you how to do EAV on teeth. And so that's why I wrote this, but it's now in several editions in. The other publication is my son, who has since passed away, was born pretty autistic. Couldn't find out why. I don't have any amalgams in my mouth. I just had my wisdom teeth taken out. But I had a high exposure of mercury. And so I kept miscarrying until I had him, and then he had a great deal of mercury in him because our blood mixed together, and that affected him neurologically in utero. As I was trying to find help for him, I couldn't, so that led me out of dentistry back into medicine, which is where I was just gobsmacked constantly that things that I had been told weren't really true in the medical world. But he amputated his finger and we regrew it, and that is just the coolest thing ever. I mean, literally regrew it. He disconnected the distal phalanx. We used some silver cloth, kept it wet, and he ended up with the same fingerprint, but not reattached, regrown. Super cool. I also like to dabble in all kinds of different research, and I was involved with Cavitat pretty heavily at one point in time, and very heavily in EAV. Matter of fact, in the beginning of my journeys for EAV, because I thought it was so bizarre, I still have a 6-inch binder of when I would find something was an anomaly, meaning it was a cavitation or a tooth that needed to be removed. I would always get the pathology report and I would staple them together because I just thought it was cool, and nobody was keeping data like that. I have had several media appearances, some of them not so major, and one of them on my son's finger. And one of them pretty major, the root cause, which was all a buzz, and Netflix, of course, removed it, but it is everywhere you could possibly find it. It's available. I've also done some podcasts where I've interviewed different people, and those are all available to you. You can either hit my website or you can go to IABDM, and there's all kinds of topics from cavitation to airway, mercury, just a whole smattering of different things. I started learning EAV in 1995. I started with Andy Landerman, who has since passed away, lost his license in California because he refused to place amalgams, if you can believe that. He sent a patient to us that had lymphoma. He wanted a particular tooth taken out. He said it was on the lymph meridian. We couldn't find anything wrong with it, just like Dr. Yu said. And so we called Andy, and Andy basically said, if you don't have the balls to take it out, send her to someone who does, because it's a huge problem for her. We took the tooth out and sectioned it, and there was nothing. There were no canals. It had done its own root canal. But it didn't show up that way on an x-ray, but it was dead. So it was an energetic blockage, which you will understand hopefully by the time I'm finished. Of course, then I started with Doug Lieber, who was a maniac with Computron, got involved with the Computron, but couldn't get technical support. So whoever you're working with, technical support to me is just supreme. Got involved with Andreas Marx, who is a German that does Oriental medicine, very involved with Marco Pharma, and then with Rob Capps, who is a naturopath, and then took some of Doug Cook's classes. The only thing that I couldn't really track or do that Doug suggested is removing people's tags in their clothing, which was such a big deal for him, and I just couldn't make that be the same issue, so I chose not to follow that. But you'll see that everybody has their own unique spin that they think makes a difference.
Why did he want to remove?
He thought the methylene blue in the tags interfered with his readings. And he stuck by that for years. I mean, you can ask Simon. I don't know why, other than that. Okay, so Dr. Voll was a German physician, and his claim to fame was that he made this comment that 80% of people's health problems could directly be correlated with something that was going on in the mouth. That was a pretty big, bold statement. I have all of his books. That makes me like a Voll nerd. Because access to them is really difficult. They're very dry reading if you want to know, but they are there. So who was Dr. Voll? You realize that, you know, people went over to Asia and they came back with this technology of acupuncture and they brought it back to German, and the Germans kind of thought, oh wow, this is really pretty cool stuff. He was born in 1909 in Berlin. He engaged in preventive medicine in southern Germany in 1943 is really when he started his practice. And he was comfortable enough with the research that he'd been doing in the early 1940s to bring EAV into his practice by 1953. He founded the Association of Electroacupuncture in 1956, and it grew into an international organization, and he was the president until 1972. Electrically, when you look at Voll's points, this is something that you need to be very, very aware of. They do not deal with disease or diagnosis. It's almost like they're a reflex point. Where do you have pain when you have a gallbladder problem? Back here, where your gallbladder is not there. So these points, you can't even call them acupuncture points, because if you're dealing with an acupuncturist, they'll think you're an absolute idiot when you're talking about certain points on the feet. They'll go, no, that's not a point for the liver. Well, who told you that? They're Voll points, so stick with the fact that they're Voll points. Realize that when you cut yourself, there is an exchange of energy that happens first before any of the chemistry happens. And you are trying to capture this energy that's going on in the body. A thermometer is something that we use on a regular basis, but it doesn't tell us if we have a disease. It just tells you what the body temperature is. And then you as the practitioner have to take that information from there. So then Dr. Voll hooked up with Dr. Tiller and Dr. Schimmel. First you have to know that Dr. Tiller set out to destroy all of Voll's work and said it's crazy that he thinks that there are actually points on the body that you can use to measure something. The skin has a uniform conductivity all over it. And what he found was Dr. Voll was correct, that all of these little windows, these actual points, is where you could gathered data from the person. They also found between the three of them that a degenerative point would have a lower reading and that the energy reading would slow down. And when there was a higher point, there was more inflammation. So I want to remind you, because I'm going to say it probably over and over again, it's invisible, not imaginary. You are breathing oxygen in this room. It also has nitrogen, but you can see neither. But I promise you, it's in this room. If we have a short in an electrical circuit, there's going to be an issue. And again, we'll describe that in a couple of different ways. I wanted to tell you that this is not new stuff in case, you know, like a patient will come in and go, wow, this is just the newest technology. I bet you're like on the cutting edge. And then I go, well, no, actually, this is, you know, something from the 1940s. It's just new here in the United States. One of my other mentors, who I didn't really mention, but he's from China, and he bought a Vol machine that the FDA came and took from his office, not because the equipment was illegal. The manual for his Vol equipment stated that it could diagnose. And because that manual had the word diagnose in there, and they found out that he had it, they took it, and of course he paid somebody else to bring another one in and then didn't need the manual, so it was no big deal. But this is not new stuff. For you people that are like me, that are very scientific minded, that go, this looks like woo-woo and I need some proof. There's tons of proof. Matter of fact, at one point in time, we were going before our board because the dentist that I was working with had taken out an anterior tooth on a gentleman whose PSA was 760. Okay, that's not good. That's horrible. His MD had written letters saying that he wanted that root canal tooth taken out, that he was so sure it was involved with the prostate issue. The daughter found out that the dentist was going to take out the tooth, and so she really paid close attention. He went back to his dentist that did the root canal. The dentist was so certain that his root canal was done adequately that he marched the patient across the hall to an endodontist who agreed it was a perfectly healthy root canal. You're going to see that's an oxymoron. Can't have a perfectly healthy dead anything, but they agreed it was, and so he didn't have the tooth removed. He later went back to the MD who fussed at him. The MD said, you have to have the tooth taken out. I'm not going to work with you anymore. The dentist did have a letter from the physician signing off saying, take out this tooth. And the way it is in Texas is the physician is over a dentist. So if a physician says to do something, the dentist is going to follow suit. And when the tooth was taken out 2 years later, and the patient is still alive, and his PSA is under 4, he voluntarily went up to Austin for the state board hearing. The daughter, losing her inheritance because her father did not pass away, turned the dentist into the state board for removing a perfectly healthy root canal. So I started doing research on EAV because I was scared to death that I was going to end up losing licenses as well, and fortunately I didn't.
Did he lose his license?
No, he did not lose his license, and they didn't go after the EAV. Actually, what happened was he had to do some CE for record keeping because the assistant didn't write down something on there. More research for you guys that don't believe what I say is so. I also put some Pubmed Studies in here. I'm not going to spend a lot of time on these because you will have the slides and you can go back and look at some of these references. But when we get into things like allergy testing and you go, okay, this is just really weird, I've got plenty of stuff in here for you that will allow your scientific mind to absorb all of this and just enjoy what you're trying to learn today. Now, this is a really, really good example of a meridian. Now, obviously, it's a road, and it's a road in Houston when we had one of our hurricanes come through, and momentarily this road is not usable. It's blocked. Once the water goes away, once the blockage is removed, whether it's a problem with the liver or whether it's a tooth that is removed, the road that's there is going to be perfectly usable. Does everybody understand that? Because in a patient's mind, they're going, okay, the meridian is disconnected, so it's like chopped, kind of when you get your vasectomy done. You hope it doesn't reconnect. There are dental uses for EAV. compatibility testing of dental materials, which Dr. You went over, testing for dental burdens, and testing during surgery, and even creating an autosode. And I won't have time to go over absolutely everything today, but I'm going to touch on things so that if those of you that are more interested want to get deeper, you can. I'm also going to run through some slides that for those of you that this is new to, as far as mercury being toxic, that there's a safe way to remove it, all this kind of stuff is going to be in these slides as well. The coloring in a denture is a problem for some people. Some people are reactive even to the teeth. Titanium, in case you don't know, is a problem because it can electrically disconnect the body. It can challenge the immune system. And for those of you that don't know, all titanium has nickel in it. How many women do you know that are reactive or sensitive to nickel? A bunch. And so what I've done is I've gone through here and I've shown you some information about that. Of course, me freaking out knowing this information last year, I had to have 2 hips replaced. Not something that I wanted to do, but I was in a wheelchair at that point. And it really took one of my biological friends to sit down with me and go, it's not the same as having dental implants done. Yes, there are some things that we can watch. But you think of a hip, it's in an environment where it can be sutured closed. The mouth is one of the dirtiest places. We see so much corrosion on some of these that if you could see ones that we take out, it would make you think twice. But I have another issue with implants, and we'll get to that later. So what kinds of tests are available to check the sensitivities? Well, you can do blood serum compatibility. Now, there are some disadvantages to this. Your patient has to be fasting. You have to spin the blood down. You freeze it, you ship it off on dry ice. Your results take some time to come back. And then you get this huge book that says safe or not safe. So now I'm going to take you on a journey. Let's pretend your patient is from Russia and they've never had a strawberry before, ever. And you want to place a strawberry filling. So you go through the trouble of drawing blood, spinning it down, shipping it off, and you send it, and it comes back that they're safe with strawberry. Well, of course they are. They can't have an antibody. They've never been exposed to a strawberry before. How many dental materials have your patients been exposed to? The other flaw with the blood testing is they don't test for things like anesthetics. When I ask why, they go, well, all anesthetics are neurotoxic. Yes, but most patients won't get dental work done without one of them. So you've got to give me some kind of idea. I'm not against it. If you're in an area where you don't have somebody who can use EAV or do really good muscle testing to tell what the person is going to be reactive to, I think it's better than nothing. But I personally like using EAV. Your teeth are organs. They have lymphatics. They have a blood supply. They also have a nerve. That plaque is a biofilm. It's like slime that develops on the tubes in your fish tank. You brush your teeth before you go to bed. You wake up the next morning, you have this slime on your teeth. Your tooth basically pooped while you slept. It detoxified and pushed its waste out through the tubules to the outside of the tooth, hoping that you will remove it either in the chewing process or in brushing. I encourage patients to dry brush their teeth just like I encourage them to dry brush their body as well. I don't think that there's a toothpaste that can help remove plaque. You know, if I did, then we would smear it in between our teeth when we got ready to floss. It's the mechanical action of the floss or the toothbrush, and sometimes that taste deadens the ends of the taste buds so the patient can't feel if they have clean teeth or not until they're driving down the road an hour later and they go, oh, I miss that area. So I just prefer that they dry brush.
How do you dry brush?
You just pick up a toothbrush, dry, and sit and watch TV. Brush all your teeth, rinse out. You know, if you want to use a mouthwash afterwards, I don't really care. And, you know, make sure you floss. Again, ADA doesn't even encourage flossing anymore. They dropped it and said that it's not necessary for people to reduce decay or periodontal disease. How crazy is that? Okay, but that's the ADA, that's not us. This is what I feel like. I feel like when I'm looking in someone's mouth, I'm looking at their organs instead of their teeth, because now that I have this information from starting in dentistry and then leaving and then going into medicine and trying to blend these worlds, you have to understand that dentists don't really learn about blood work. So all of a sudden when I'm learning about blood work, I'm going, no, how come this person's labs are all jacked? And they've been that way ever since. And then you'd query them and find out that they had endodontic treatment done in this year. And now they're living with a chronic low-grade infection. And now their hemoglobin A1C is elevated. And it's all because they have a dental infection. How cool is that? Hang with me and you'll learn all kinds of stuff. So yes, we connect the dots in what I call the tooth-body connection. We do have meridians that are these invisible, not imaginary, pathways that go all through the body. I think one of the things that was the most interesting to me was when I first learned about this, and I was trying to learn from someone whose English is not very good, and this is no reflection on you, it was not you. But it's someone who really was having a difficult time with me, and he was trying to tell me that it make a quick on the face. Can you just say that one more time very slowly so that I can try to write it phonetically? And it still didn't make any sense to me until probably, I don't know, maybe a year later, when I'm actually, my thesis work was on the meridians. I took everybody's meridian chart, everybody's, and went through and found where there were discrepancies or where there was something that could be added. Sometimes there were actually errors, sometimes just in typing, sometimes they had accidentally flipped areas. So I went through, and when I was doing this, I went, oh my God. All I could hear was Dr. Kong saying that this tooth is related to the thyroid, this tooth is related to the breast, and it makes a crisscross on the face. I was having the most difficult time. The wisdom teeth are all on the same meridian. But then when you start learning about your maxillary molars and you try to line them up with the mandibular molars, they don't line up. They go to the bicuspids. And they flip when you get to the bicuspids and go to the molars. So you'll see how I dealt with that in my mind with me looking at my charts. These are just some of the charts that I pulled up. I mean, I had so many charts, it wasn't even funny. And I was finding that this was not new information. Okay, here's one that shows some arrows. So it gives you an impression, hey, you should be paying attention. Maybe these teeth don't line up. This is the one that I'm sorry, apologize.
So what does the crisscross mean?
It means that those teeth that are the molars on top relate to the bicuspids. You'll see closer in just a second. Hang with me for just another minute. This is the one that I actually use on one of my business cards right now because I thought this one was really pretty. And so you'll see that. Dun, dun, dun. Because I thought that that was really cool and it kind of explains what I do. This is my thesis work. So what I did was I took everything in everybody's chart, and because my son was neurologically challenged and we were trying to homeschool between my husband, myself, my mom, which is a nightmare in itself, I decided to color code it. And when I started to color code it, you could see, well, I started with the anterior teeth because most of my research was showing up that men had elevated PSAs. They either had a missing anterior tooth or they had a root canal. And so I had this pile of people with dental issues that could be correlated with actual lab work. And so I knew that that was on the prostate, on the uterus, ovary, kidney, bladder. So what do kidneys and bladder make? Pee. So I made it yellow. And a pretty color next to yellow was purple. There is no rhyme or reason to the colors other than how I chose to place the colors on here, other than the urine makes sense for me. Okay.
The liver is dark, so that makes sense. It's almost that color.
There you go. But you can now see that the green tips in and that the blue makes, so it makes that crisscross, but it's in color for me because that's how my brain processed this.
Cross midline?
Occasionally it can. You can have a pan focus. You can have one tooth that jumps off of its meridian and ends up screwing up a whole body. Okay, then I learned about acupuncture points on the face and got involved with a couple of other things. I am going to run through these because it's in my book, it's on the slides. It is just simply how each of these teeth go to different meridians. This is how you would chart something in a dental office for you physicians that are in here. I always tell somebody you have to have a Panorex. You have to. You have to. I'm going to say it again, you have to. Because there are so many quirky things that show up. People have had teeth taken out. They have supernumerary teeth. They've had bicuspids removed. I had a lady in the other day, and she was in a car accident, and she has all kinds of wires in her jaw. There's all kinds of things that you cannot see by simply looking in someone's mouth. You will look like an absolute idiot if you misnumber a tooth and tell someone they need to have that tooth removed. This is a really good example. There are normally 8 teeth that are in a quadrant. There are 10 for this individual. So again, don't try to test people without an x-ray. Yes?
If they have supernumerary tooth, how would you know which meridian it goes to?
It doesn't matter at this point. You're going to go ahead and test it as an individual entity. Then working with a dentist, of course, you could learn to test the teeth. You have to learn the numbering system so that you are not telling them to remove a wrong tooth. This helps the communication between the two of you. If you choose to test teeth, I want you to get trained so that you're really confident in it and you're not diagnosing. Did you hear Dr. Yu say that, you know, he says he finds something and then he wants the dentist to collaborate and see if they find something. So I always tell people, send them to the dentist with what you found and then see if you guys can't work as a team. This is the part I'm going to run through. This is each of the teeth and what they are related to, and I'm going to show you in a new way how that connection happens. So what's the current theory of decay? You tell a patient that if you don't brush your teeth and you get a cavity, it means I'm going to shake my finger at you and tell you that you're an idiot, you don't know how to brush your teeth, you've got the wrong end of the toothbrush in your mouth, or you're not flossing. Thank God you met me and I'm going to show you how to save your teeth. So this is how you take care of your teeth. Oh, and by the way, don't drink or eat a lot of sugary food very often because the carbohydrates are consumed by the bacteria in that nasty plaque, and that bacteria then tinkles on your tooth, which makes decay in the tooth. That's how decay happens. Does everybody agree with me? That's the current theory of decay. Okay, this man is almost 50, never had a cavity in his life. I just saw this guy, I don't know, there might be a date on his MSA on here, but recently, and decided to use this as a teaching opportunity, so I asked him if I could. His family, somehow he got an email saying that the United States government was going to start collecting people who had not been vaccinated and putting them in concentration camps and vaccinating them. And so, in fear, he moved his family out into the country. They are working off of a generator. They don't even have running water. I am so happy I'm not his wife. Okay, so that happened in June of 2020. Just recently, he started experiencing a toothache, so he had to come out in order to find a dentist. Those of you that can see, notice that tooth number 2 has a decay on the mesial, and it's really good size. It's probably very close to the nerve, which is why he's experiencing a problem. But I also blew up the part of the Panorex to show tooth number 20, and on the distal, he has decay. Okay, now, when I see the MSA and I sit down with him, you're going to see something show up. Now, I don't ask anybody anything about their health I don't want to know. Matter of fact, I'm a little rude when I go, don't talk to me. Just let me do my stuff, let me collect my data, and then we'll have a conversation afterwards. This is his MSA, which is Meridian Stress Assessment. Okay, this was on March 17th, so I thought I had that on there. I then start doodling on it in front of them. So tooth number 2 shows up with caries nosode, which is a homeopathic. That should mean there's decay. But it also shows up with chronic pulp. So it means that this didn't happen just yesterday. This has been going on for quite some time, and it's due to the thyroid. Tooth number 3 shows up with thyroid affecting the tooth. Tooth number 14 and 15 show up with thyroid affecting the tooth. They're low readings, but they have a thyroid issue. And then I go down here and I see tooth number 29, thyroid affects tooth. So I go, holy moly, dude, what's going on with your thyroid? That is just like an 8-ball. I can't believe that you could find that about me. December of 2019, my doctor told me that I had a nodule on my thyroid, but then, you know, COVID happened and life got in the way, and I haven't been to see anybody. Of course, in my mind, I'm going, this guy probably has thyroid cancer. I mean, there's some huge problem with the thyroid in order for it to show up on a tooth. those teeth are not getting the same amount of energy that other teeth in his mouth are. So let's back up here. Let's look at, oh, I love my pointer here. It's just the kind I can use. Okay, there's decay here, but there's not decay here. Why? If the current theory of decay was true, then you're telling me that that bacteria is so smart that it can back up to tooth number 19 and just whiz on tooth number 20. No, that doesn't happen. This tooth has more energy going to it. Therefore, it can thwart off the acids that this tooth cannot. And when you start understanding that, then you will understand why Dr. Yu is finding things sometimes before they happen. Because remember that energy precedes our chemistry. Okay, there are some other things that show up for him. I wrote down that there were an adrenal issue on one tooth, and so I usually scribble out to the side things that I want the MD to pay attention to because it is a team effort. Yes, this patient came in from a dentist, and about 60% of my patients come in from dentists around the country. About 40% of my patients come in from physicians where they go, I don't know what's wrong with the person. Go see Dawn and see if she can figure out what's going on with you. So I wrote down, it could be a methylation issue, could be MTHFR or a COMT, could be that they have cortisol levels that are off, could be food allergies, could be blood sugar swings, it could be that they're low in B12 or folate or magnesium. Not my job, go away. Take this piece of paper to the dentist and you need help, okay? You see how easy this can be? So I haven't given any kind of a diagnosis. So what kinds of, yes?
So can you back up to the previous slide? You have all those like thyroid effects too. So I'm coming from the medical perspective and from like with Dr. Yu.
Okay,
we're
so
thinking that it's the tube that's affecting the organ.
it can go both ways. You can have an organ. Let's say this person is low in iodine. Let's say this person has mercury in the area of the thyroid. Let's say this person has Hashimoto's. Let's say, God forbid, that he does have thyroid cancer. I didn't want to write anything down in this case because I really thought, I gave him a name of somebody to go to and I knew that that person would know my heart and would investigate. So I'll be keeping up on that case.
So a quick follow-up. Does that mean in this case that if we fix whatever is affecting the thyroid, then the tooth will recover?
Yes, thank you so much. That is exactly what I wanted to try to relay, because in traditional dentistry they would say, okay, we can root canal tooth number 2 and you'll get to keep that tooth because we're all about saving teeth. That's important. You don't want to have a tooth taken out, so let's root canal the tooth and put a crown on it. And tooth number 20, we're going to drop a composite in there and then you're done. No, this person is set up for failure. Do you understand that this thyroid problem could make any one of those teeth spontaneously abscess with no decay? And then the only thing dentistry knows to say is, well, you must have had trauma, you must have been hit in the jaw, or maybe your bite is off, and you're grinding your teeth at night, and maybe that's what traumatized it. No, this person has a thyroid problem that is leaving these teeth susceptible to issues. So yes, it can go both ways.
I was pretty successful, like when people come with, and these are people with rampant decay with huge deep cavities, but the tooth test's vital. So I clean the decay out, and I even expose the nerve because I have ozone water.
Yes.
And it's actually when you open it up, like there's actually some pus that comes out, but the rest of the nerve is still, you know, it has blood in it. It's not bleeding profusely, but I do some MTA in the direct bulk gap with ozone injections, and the tooth stays vital.
And that's good, but why did the decay happen to begin with? That's the whole concept of biological dentistry, is this poor guy made it to almost 50 with no decay. You know, he should make it the rest of his life with no decay. Something interfered with that process. And if we just take care of the decay, which is what you were taught in school, you're missing the bigger picture.
My question is, do those teeth have to come out?
The teeth that you're talking about, he is probably going to have tooth number 2 taken out. No, in this case, I want him to address the thyroid issue and see, it's kind of like having, pretend I have 10 azaleas in the corner here, and a couple of them are turning brown and the leaves are starting to drop off. I go over there and find out there's a kink in the water hose. Smart me, I'm going to unkink the water hose and try to get water to these. They're guarded. I don't know if they're going to continue to die or if I got to them in time with getting water to them, if I can turn them around. In this case, it's a very strong case for the body being a problem. You have to understand that coming from a very conventional world, you know, we were told, again, shake your finger at the patient when they have decay. All of a sudden now I'm looking at children's teeth going, the only cavities they have is in the 6-year molars. So it made me ask the mom, is your son constipated? Does he poop 20 minutes after every meal? He poops twice a week. Okay, that's a problem. And it could be the large intestine, but those teeth are not getting enough energy. So again, it goes both ways. A bra, I can't tell you how many times I check women and I see that the tooth has a low reading, and I go in to see what the issue is, and I see that the lymphatics are involved. So I'll ask them, are you wearing a bra? Oh, of course I am. You think I'd go outside without a bra? Okay, well, I have on a XXX sports bra, XXX. I have to order them online. Do you think I need to wear a XXX? I hope not. But it's because I don't want anything touching on the side that will restrict the movement. It's like saying, Dr. Dawn, I'm here because I have blue thumb syndrome. Yeah, but you have a rubber band on your thumb choking it off. No wonder you have a blue thumb. Take it off. No, my mom put this on when all us girls turned 12. And we only can take it off at night. Okay, that's stupid. So take it off right now. I'm telling you that bras can kill teeth. That's how ridiculous it can be.
Can I make just one comment?
Yes.
So the question you're addressing is a medical point of view. What the reading we have, like I don't usually send to dentist right away. If your dental reading is like a low 41, 39, sometimes you can regenerate. That's what you do, cleansing, detox, whatever. Then sometimes you would go back to normal at 50. Sometimes reading might be 35, and the patient really sick. I sent to the dentist, get a second opinion while I'm doing my job, detox and cleansing, parasite cleansing. And dentist say, I don't see any problem. Patient come back, and I check, and sometimes it looks fine. Because you have to clean the whole body. That's what she's saying. But if the reading dropped down to 20, 15, it usually almost always requires intervention. And they're usually very sick people. Yeah.
So some of the things on here, which we will go over, are root canals and extractions and crowns and impactions and even missing teeth or non-vital teeth that have done their own root canals. It's important to me that when you are taking your bite wings, and I always teach this to biological dentists and their staff, take a periapical of every endodontically treated tooth. You will see it ultimately fail. It's not scar tissue. And of course now with CBCTs, people believe me, but you can see all kinds of issues with this particular tooth. Here's one where this is a brand new crown on a severely neurologically challenged individual. They were actually put to sleep so that they could have this dental work done. And then she came to see me, and I picked up a dental issue, so I just asked if we could take a periapical. Can you see something wrong with this? Of course, it's just a crime that that's a brand new crown, and the crown that's the distal crown doesn't even have a good margin, and this is considered permanent work. Sometimes we find things like broken instruments. Yes?
Can you explain it to the people that aren't dentists what you're seeing?
Oh, certainly. Okay, there's internal resorption. There's, that's a great question, thank you. There's internal resorption. There's basically the tooth is decaying even from the inside of the tooth, but here easily it could be decay that started there. This crown does not fit the tooth that you see that has a lap over. Okay, it's an overhang. As a poorly fitting crown, I would be embarrassed if I were that. If I even worked with that dental office, I'd be dying of embarrassment. You'd see things like this on x-rays and they go, oh yeah, it broke off during surgery, but it's not causing a problem. How in the heck do you know that? You're not testing. It's just crazy. So when we talk about dental foci, they are areas that are concentrations of toxins where the body has chosen to wall it off or surround it with lymphocytes. That is what blocks the flow of energy on that meridian. And the energy gets into this area and basically hits a black hole and is dispersed in different directions. I do thermography as well, and so sometimes when you're using thermography you expect to see things, but you don't always see heat where there is a problem. Sometimes we see cold where there is a problem. In this case, you would expect, again, thank you for pointing that out to me that I need to point out things. There is gross infection at the tips of the roots there. And here we see a pimple, or what we would call an abscess on the side of the tooth. So we would expect it to be warmer in this case. This is how this person imaged. No, not that person. This is how this person imaged. I take a face forward, and you see that in thermography, the areas that are white are the hottest, then red, then orange, then yellow, then green, then blue, then black. Okay, it goes in that order, black being, it doesn't even measure. Can you see that when she is facing, which this is her right side of her face, it's different than the left side of her face. Here she has an area. She doesn't have any pain. Now she does clench and grind, and I can see that because I've got white in both ears, but there's more white on this side. So I'm inclined to think that there might be a problem. I asked her if I could take an x-ray, and then we see on the x-ray that in fact she does have a root canal right in this area. Oh, it's just a coincidence, isn't it? Okay, when you're using your EAV, we've got AMA, EAV, CEDS, EDS, so computerized electrodermal screening, meridian stress assessment. They all mean the same thing. It's basically using an ohmmeter to touch different points, and you put electrons in, you want to see how many electrons come out. That's it in a nutshell, just that easy. But you can use it for surgery. You can use it to evaluate the procedure. You can use it to create pre-surgical homeopathics. You can use it to create a homeopathic for the anesthesia that is being used. I don't even care if it's just the local that's being injected. It will help the body recognize it and work it out so that they don't have problems with it. Anesthetics, most of them break down into anilins, which is a whole different issue. It will help you with site entry. Let's say the person is edentulous, which means they don't have any teeth. How do you know where the cavitation is? Yes, somebody pointed it out to you, but now how do you know where it is in the mouth? You can actually help go in and figure out where that area is. Making access into that osseous site, curettement and debridement is all done by the dentist, but knowing when to quit is the person that is working the EAV, because they are cleaning out, let's say it's a pumpkin, and you cut around the top of the stem and you lift it off, and now you're going to go in and clean out all that pulp and the seeds. That's what a dentist is doing when they're cleaning out a cavitation. I ask them, make an incision in the top of the gum, retract the tissue, and you will see white bone, but it's not necessarily healthy bone. Even if you're looking at an x-ray, it may have filled in with things and it's going to be a void, but it doesn't look like it on the image. Then I want you to take your drill and gently start it and push down. If it were solid bone, it would be like pushing a drill through a 2x4. But instead, they're going to pop. And when they do, they know they're in a void. So they're going to make a small window, which will be removed, and now they can take a smaller instrument called a spoon, but it's not like one that you eat with. And they go in and clean it all out until they can feel solid bone. How do they know they're done? How do they know? Okay, pretend that I send one of you outside and we want to change one of these ballasts. I don't want to get electrocuted, so I need someone upstairs or someone outside to be flipping breakers and tell me when the breaker for this light is off. So we're screaming back and forth to each other, but we cannot see each other. Do you understand? Mm-hmm. Once I get it replaced, I'm going to start screaming back and forth to flip the breakers back on. That is what you're helping a dentist with when they're doing surgery, so that they know when all this dead bone is out and the meridian has reconnected, because you hit 50, 50, 50 every time. So dentists that get used to using this during surgery feel like they've had both their arms cut off. If the person that does the EAV leaves for whatever reason or is on vacation, they feel so challenged because they become dependent on doing it. It will also assist you in making your autosodes for afterwards and for the closure, and for post-surgical homeopathics and for follow-up. Did you have a question?
Yes, do you irrigate the area?
Oh my gosh. We irrigate it with something that's alkaline, we irrigate it with those, but not until you get a 50, because you don't want to change anything. You want to get your electrical connection, and then you want to deal with, because it's not really a bacterial issue, it's an electrical issue, and we'll go into that, you'll see. So the cavitations, every bone is connected to another bone by way of a ligament, and in dentistry they teach take out the tooth, do the least amount of trauma possible, just take out the tooth. So me learning that, even though I started as a hygienist, hygienists in Texas go through the first year that the dental school students go through. We actually have to place and remove amalgams. How stupid is that? In certain states, hygienists can do that. So in Texas, we couldn't do it on patients, we had to do it on dentures. Major mercury exposure, sitting there drilling and breathing with no protection whatsoever, over and over again, so that I could get that off my list.
Did you blow the air when it was
Oh, I mean, we did all the stupid, we were playing with mercury in our hand, look, stupid stuff. Because when I was there, you had to mix your mercury drops with your pellets of amalgam and put it in the triturator. I'm old. These guys, they know what I'm talking about. I just pointed you out as being old, yes. So I leave dentistry and, you know, I'm in the naturopathic world and we're talking about a D&C. And I raised my hand and I said, well, actually you don't have to do in D&C. I don't understand the value in having to have to do it, because in dentistry we could take out a tooth and just leave the ligament and we're told that the body deals with it. So can't the body just deal with this too? And it was actually my professor who said, okay, so you're the one that's like already been a paramedic. And I said, yeah. Okay, so you deliver a baby, but before the afterbirth, you just decide to suture her closed. Well, no, you can't do that. She'd become septic. Okay, so dentistry is not medicine. And unfortunately, it's not that you were lied to, you just weren't told the whole truth. And if you knew how the body really worked, you would lean more towards what we're talking about in biological dentistry. This is thanks to Dr. Boko. Jerry and I did some crazy research where I changed some of the ways things were done, and you'll see that on here. But you can get cavitations in different parts of your body. It's been called different names through the years. This is again from Jerry. This is a man who had trigeminal neuralgia and had excruciating pain, was looking for help. He ended up having a technetium-99 scan done, and all the dark areas are osteomyelitis. Once he got his results and realized that it was all in his spine and in his face, he committed suicide and willed his jaw to Jerry. Cool. So he says it's the only time he's ever gotten anything like that, where he's gotten a head, but it was so that he could use this for research. That area that is dark is necrotic. Electricity can't go through anything that's dead, and in certain instances it will create pain. It should look like the nice white one on the right, and instead of the dark one that's on the left. There are different risk factors. Some of them are controllable, some of them are not. The person could have protein C or S deficiency. They could have a plasminogen deficiency. Smoking plays a big part in this. Different drugs, including anti-inflammatories or vasoconstrictors, diseases of circulation, trauma like football. So now all your football players are going to be at risk for this. Exposure to pathogens, now everybody is at risk. When you clean out those pockets, these areas could be areas of dead bone with no blood flow that are holding toxins. And for me, in thermography, why that's important is because it won't image red. It will image blue because it's avascular. You understand? That's me many years ago, and I actually am sitting up on a chair only for the picture, because usually I am on the floor. I don't like to know where they are, because if they've taken out a tooth and I'm taking a reading, I don't want to know where they are. So, and when I would take my reading and it wouldn't be 50, they would continue to clean out. And one day Bill got very, very frustrated. That's the dentist that is in this picture. He got really super frustrated at me and went to another tooth and touched it, and it went up to 50, whereas we were down around 30. And I went, oh my gosh, you're done. No, I just want to make sure you knew what you're doing, because this is very frustrating here. He actually ended up having to perforate through the maxillary sinus, which is a dentist's nightmare. They don't like to do that. But if it's dead tissue, it's got to go. And this was my very, very first case that I freaked out about. Well, no, it's my very first case, comma. I did freak out. It's my first time in telling someone, okay, I see that you have a root tip that's broken off in there, and I'm sure you've been told that that's not a problem. I actually am seeing that there's a problem, but I also see that there's a problem in the area, more than just that, and I see that there's an area distal to the molar. And so Bill was willing to go in, and that is exactly what he found. There is no drill used in this. It's crazy. So, documentation. This is something you probably want to take a slide on. When I started in dentistry, documentation was the person's chart was pulled, you wrote the date, the tooth number, the surface, let's say O-C. I did a composite on the occlusal surface of tooth number 14. That was it. And that's what I was used to. Okay, I left and went into emergency medicine. If you knew my whole path, I mean, it's just crazy. I spent years on an emergency ambulance. I also became a flight medic internationally, and so I have gotten to do some really cool stuff that only happens usually in a hospital setting on people that were not in the hospital. But I learned that you had to document differently. I learned that if it wasn't written down, you didn't do it. It doesn't matter what you said you didn't do it. But dentist's charting is not that way. And so when I came back into dentistry, kicking and screaming, because I really didn't want to go back into dentistry, it was Bill Galeros who said, I need somebody who understands about dentistry, but also understands the body, that is willing to change into this person that can interconnect the two. And if you're willing to do that, I can direct you about where you need to go, which meant go back to school and take out more student loans. But that's okay. So when I sat down with Jerry and said, we're going to send all of our path reports to you for everything. Teeth that are removed, cavitations. This is how I know how to document things from medicine now. So it's going to be completely different. And it's things like, why was the surgery done? Was it because the patient was in pain? Was it based on EAV? Was it based on an x-ray? Was it based on a physician sending them there and saying that they have cavitations? And you do want to document EAV because there are white papers on EAV. So yes, do put that in your documentation. How many carpules of anesthetic did you give? What kind of anesthetic did you give? The exact times that they were given. What physician would give epi and then give epi again and then give epi again and not document how the time for those? Dentistry doesn't do that. So you're going to start doing that. Where was it given? In the butt? No. But you have to document it or it wasn't done. Where your incision started and where it stopped. What did the cortical bone look like? Were the proceeds oily? Those of you that have done cavitation, sometimes you'll see this oil kind of float up. How is it rated? Just a little, medium, a lot? Are there bone shards? What's the color? Was there augmentation used? What specific kind? How many sutures were placed? What kind of sutures were placed? Does the patient smoke? Because that's super important. Did the surgery go as planned? Did that person walk out the door unscathed? Because if they come back and say that they were raped during the process, you don't have that documented. Were the vitals taken before and after? Was nitrous used? If so, what was the percent of O2? How did the patient arrive, like by car? Or did someone drive them? How did they leave? Who did they leave with? Who was the assistant during the surgery? This lawsuit is going to come up years later. And you may have a different assistant now than you had then, and that assistant is going to get called into the lawsuit. How long was the entire surgery, lengthwise? And where did we send any biopsies or cultures? Is this different than what you document now? Because if it is, this is how you should document your surgeries. And get results of your pathology and make sure that they are included. And so you will see on here that I have poorly forming new bone with ischemic damage consistent with bone marrow edema. Bone marrow edema is different than osteonecrosis. Osteonecrosis is dead bone. Bone marrow edema means the blood gets in, but it can't get out. It's like having asthma. You get the air in, but you can't get the air out. So bone marrow edema is different. Giving Jerry as much information as I got changed our pathology results. We would get information back, person at risk for clotting disorders. We never got that information before I started documenting the way I was doing it. This person was healthy. She was a patient of mine. She was cruising and traveling all over the place. Her husband had passed many, many years ago. She was dancing every time she'd come in. She'd tell us about all of her adventures. It all came to a stop. I got in touch with her daughter to find out what happened. Oh, Dawn, she didn't want you to know. She was dancing, and while she was dancing, her denture flew out, which was an incredible embarrassment to her. So she decided to have some permanent dental work done. But after that surgery, she got so sick that I had to admit her into a nursing home, and she died. I said, she died? Oh my gosh. Can you get any of that information for me? I'm just curious. Okay, so this is why it's so valuable to actually see an x-ray, because if I write it all out on here, it doesn't look so bad. That's her x-ray. Where do you see those implants go?
Sinus.
Into the sinus. Those are now foreign bodies. She died of old age. That's what's documented. She didn't die of old age. That's iatrogenic.
She died from a loose-fitting denture.
Yeah, a broken heart. Okay, so we're talking about root canals. Usually when I'm teaching a group of physicians, not necessarily here, but I will ask if anybody has a root canal, and usually I get a hand or two that will go up. And so I want to make sure that they understand fully what a root canal is. So I try to put it into their world. I smashed my finger in the door. It's really traumatized. It's not going to have to be amputated, but it doesn't look so good. They're questionable. So we're going to make an incision, and we're going to suction out as much of the tissue as we can, and we're going to remove the nerve and the blood supply and the lymphatics, and we're going to shoot it full of silly putty. It's starting to look dark. We're going to dip it in plastic. Yep, that's good. And the physician will go, no, you have to amputate that finger. If it's that bad, you have to amputate, because that person is going to be septic and they're going to die. It's going to travel up their arm, and if you don't get it then it's going to go up to here. If you don't get it then, they're dead. Yeah, welcome to my world. That's a root canal. And yet, dentists are told they are removing the nerve and the blood supply and the lymphatics in the tooth, and that they are sterilizing the tooth. That's what they're told. They're not bad people. They're just terribly misinformed.
Have you ever got to test teeth that were treated with like photoner laser?
Oh, yes.
And then they're still coming back with...
Yeah, dead is dead.
Okay.
Yeah, you're going to get that in a minute. No, watch this, and you create in your mind what you think is right, because I'm going to give you different information than what somebody who's trying to sell something. I got nothing to make off of this.
Yeah.
All I'm going to do is tell you what my experience has been over almost 30 years now. So just listen, and then you can create your own. This is the anatomy of a tooth. For those of you that have never seen an anatomy of a tooth, you got a blood supply that comes in from the bottom, lymphatics and a nerve. Then you have these tubules that are filled with marrow like a soup bone. Now when we do a root canal, we can only take out that part that's in the center. We can only take this out. We can't take the yellow out. It's not possible. So if I bury a soup bone in the ground and I come back 2 weeks later, there'll not be any marrow in there, but there's no blood supply in the dirt. God put bacteria on this planet to scavenge dead flesh. That bacteria is going to get in this dead tooth, regardless of whether there's a blood supply or not. Now, there's a blood supply that's left down at the bottom of the tooth, but even if we give an antibiotic to this person to kill the bugs that are in here, it can't get up there because we took out the blood supply. So it can only get to the base of the tooth. When you start taking periapicals of endodontically treated teeth, you will start seeing things that will just make your jaw drop. You're not having any pain, are you sure? This particular person, you can see that the tooth next to it has a hairline fracture in it. But this was due to trauma to begin with. So what's the big deal about root canals? Well, first off, energy can't go through dead tissue. It's not a burden that is overwhelming to every person, because every person is unique and different. But if that's an infected tooth, every single time that person chews, a little bit of bacteria comes out of those tubules and scoots into the bloodstream that does still have blood in the bone. And it is carried to another area of the body. Used to have an infectious disease control doctor in downtown Houston that would refer patients out to me when she was getting ready to amputate a leg whenever she found osteomyelitis in a knee, because she thought she found the connection, that whenever she found that, I was certain to tell her there was a tooth that was an issue, which I would, because there was, but she's not the person that found that. It's just that she stumbled on it, and which is great, but it's crazy how it can go throughout your body. There is no such thing as a healthy root canal. It is a taxidermied tooth. There is no such thing as a biological root canal. Now, I'm going to have certain people go crazy, but just bear with me. Right now, the current theory is that we ozonate it to reduce the bacteria and the virus and the fungus and the parasites that are in there, because that's what ozone is good for. We use a laser to try to sterilize it as well. We use gentle wave to try to get some of the tissue out of the tubules. and we tell the person you have a biological root canal. If I have a lamp and I plug it in and it works, I know I've got power coming to the building, a good cord, a good outlet, a good light. Now I unplug it, I take an X-Acto knife and trim open some of the plastic and cut out an inch of the wiring and plug it back in, my light doesn't come on. Well, maybe it's a bad bulb. Let's go put a new bulb in. No, do you understand that it is an electrical disconnect? The reason my light is not working now is because I removed part of the wiring in this lamp. Now I've called an electrician because now I realize that he can splice the wire back together and my lamp will be good as new. But while I'm waiting on the electrician to come, my dog poops on the wiring, right where there's a void. The bacteria is not the issue. I get it that dentists are all, oh, let's do this to try to reduce the bacteria. Let's send them to an endodontist so they can have the tooth retreated to reduce the bacteria. The bacteria is not the issue. The issue is the electrical disconnect. You have a taxidermied tooth with about 1.5 inches of electricity disconnected. Electricity cannot go through dead tissue. If you're on one side of a door and I'm on another and you have Christmas lights and we want to know if your lights light up and I plug in an extension cord and the door is closed, it's a sliding door. I'm going to start sanding the door. How much of that door do I have to sand away before we can connect? All of it, which means removing the tooth and all the dead bone, and instantly the body reconnects. God made this incredible piece of equipment. We are designed to heal ourselves. My computer can't even do that. When I cut myself, I don't have to go to an encyclopedia and look up the clotting cascade and tell my body what to do. It's programmed to do that. The bleeding stops, a scab forms, the skin heals over it. I'm healed. Do you understand that if we remove everything that's the offending factor, electrically, you can heal yourself?
So, Dawn,
Yes.
the argument that an endodontist has, and I have talked to one of my friends, and I said, obviously, endodontists have nothing wrong with root canals. So, when you have this conversation that the majority of people can handle a root canal, you hear that statement. You know, I have a root canal.
I'm going to show you
Okay.
some of the majority,
And
but
then,
go ahead.
then we get into the conversation, I started talking about the immune system. You know, and that just blows them out of the water. They don't even talk about that.
Did Dennis learn about that
No,
in school?
That's the problem. He's
Yeah.
not going to be able to back it up with the immune system.
And so I always say, well, and I will say, because I had a lecture one time with some colleagues, and a few more endodontists, and now my thought process now is like, some people can handle it, but they're not cure of it. I mean, it's just waiting for that day where they wake up.
I
and
do
they all
agree.
of a
I
sudden-
don't tell people to have every root canal taken out until I test it,
Right.
because I want to test it and see how their body is handling it.
Okay.
Um,
But that's not even in the realm of
No.
conversation.
No,
with-
my purpose in putting this in here is, as the executive director of the IABDM, of course, we get phone calls all day from patients. Our organization answers phone calls. I mean, we talk to patients and educate them. And so when they're going, well, this dentist told me that they could do a biological root canal, I have a conversation with them about this. This is what they can offer you. They can reduce the bacterial load, which may be a temporary help for you. What they can't do is bring this tooth back to life. It's like voting for the healthiest of dead people in a morgue. One of them may have all the flesh off of him, and one of them may be newly dead. He's still dead. I just need for you to get that concept, and by the end of this presentation, then I'm going to ask you to think where you are. This lady saw a biological dentist. Then I looked at the Panorex and went, no, you didn't. But she was told the dentist was a biological dentist, so she believed that. But this is some really horrible work, and she's got root canals that are on the meridian to the breast, and when I started doing thermography, there was just this red line that went right down to the breast.
There's a few patients that just refuse to get things pulled.
Yeah, that's fine. It's their body. They can do what they want. Not my job. So with root canals, of course, we have gutta-percha shrinkage. So we're told we put the gutta-percha in, but then it shrinks. So bacteria is small enough, it can just creep right in there, even though it doesn't require a blood supply. Those toxins can create secondary infections anywhere in the body. You've got thioether and mercaptan, which were used in the World Wars. Those are the off-gassing from specific anaerobic bacteria that can oftentimes cause neurological jack with your brain. They are energetic blockages. If you think of it this way, you pick up a nasty, dirty, filthy phone that's been sitting in cow manure for days, and you try to call 911 for help, but the phone cord has been cut. There's effort on your part to go through the process, but you will not get your desired result, which is to have an ambulance there, because there's an electrical disconnect. Do you get it? There is bacteria. I could give a rat's ass about the bacteria. These teeth, we were told certain teeth had certain numbers of canals, and then only the endodontists found out that there in many teeth were extra canals. But really nobody talks to you about the fact that some of the canals can go laterally. It isn't until you start looking at teeth that have been dyed, and there's lots of research out there on that to show how many canals can be in a tooth. These dental tubules are really small, but they're filled with that marrow. Now remember, when the tooth was healthy, the tooth detoxed at night and pushed its waste product out through those tubules to the outside of the tooth, creating that biofilm. When the tooth becomes sick or is exposed to sugar, and that's based on research from Loma Linda, the flow reverses and it comes in. This is a tooth that was lasered. The person flew out to California because at that time, this is, if you look at the year on here, and I could probably remove stuff to find the year, but I'm going to say it's early 2000s. Yeah, they flew out to California in order to get testing done. And this is when Boyd Haley had ALT. And so we're looking at the amount of inhibition of enzymes that help the body create ATP. This person was told this tooth was sterile. We didn't have DNA testing to see the bacteria. This is the best that we could do. 3 weeks after having that tooth sterilized, she made the choice to have the tooth removed. So this tooth is removed, and there's 38% inhibition of the enzymes that have to do with the body's production of ATP. That's pretty significant. This person's probably taking glutathione if they're dealing with somebody who knows. But 3 weeks later, so basically 3 weeks after being sterilized, this bacteria has remorphed. So the analogy that I use, and you'll see in many of the different videos that I've done, it's like having a dead cat on my countertop, and it's got maggots all over it. So I call a pest control to come out and spray the maggots. They're gross, they're moving everywhere. He sprays them with ozone. Ah, I found a natural pesticide person. Great, I'm excited about that. All the little maggots die. Okay, 3 weeks later, I call him up. I want my money back. What? My cat has maggots again. Lady, you didn't throw out the cat? No, I love that cat. I plan on keeping it here. You're kidding. Okay, all I can do is come out on a regular basis and spray your dead cat with ozone. That's retreating a root canal. At some point, the dead flesh that's in there is going to call on bacteria that's in God's plan. You guys are not going to change God's plan. I don't know who you think you are, but you are not going to change God's plan. That bacteria is going to end up back inside of that tooth. It's in a dark, moist, warm environment and is going to multiply all over again. So all you did was reduce the bacterial load and get some money out of it. But sometimes people choose that. This is the same patient. 6 months later, decides to take out 3 anterior teeth, 8, 9, and 10. Can you see that that is 78% inhibition of the enzymes? Her chief complaint was, I cannot get my ass out of bed in the morning. And now we understand why. Now we have DNA testing that we can do. We can do it for perio, and we can see the link between different dental infections and cardiovascular disease. We can see that the root canals really could be, did you need to take a picture of that?
The oral DNA. Thank you.
Yeah, if you guys need to take a picture of something, sometimes I'm good about seeing the cameras go up, but if I'm not, just let me know. Now we know that research does show that secondary infections can happen from dental infections. This is a DNA Connections report. I'm sorry I stuck this one in rather late, so it's a horrible copy. You can see my hand trying to take a picture of it. Point being, oftentimes the patient is not educated about the value of having this test done. So when I do my MSA readings, usually they have not seen a dentist yet, or they've seen a dentist for a new patient visit, but they've not been given their treatment plan because the dentist needs my input in order to make the treatment plan. So I am the one that drops the bomb on them saying, there is a test that you could do on this. I mean, they can just throw the tooth away after the tooth is removed, but you're going to miss an invaluable tool for your physician. If this tooth is sent off, which is going to cost you about $550 to send it off, but in case you're not familiar with doing this testing, there's a vial that's filled with liquid nitrogen. Open it as infrequently as you can, but you can put up to 6 teeth in there. It's not, the test is not per tooth or per sample, it's per test. So if you're doing cavitations and you're doing a couple of extractions, cram as much as you can in there and then get this report back. Well, then when the report comes back, the dentist calls me and goes, well, what in the hell am I supposed to do with this? This is, I don't even know what this is, but it looks bad. Yeah, okay. It's like a physician removing a mole and sending it off and finding out that it's melanoma. You're not the person that's going to be dealing with that. Obviously, this is outside of your scope. So refer them to a physician that can handle it. What if this comes back with Borrelia, which it does often? This person maybe has gone through testing multiple times to see if they have Lyme, but it's always been negative because it has to be at a very specific time unless you're doing PCR testing, which this is. Question.
Yeah, in my mind, I always, from a scientific point of view, research point of view, I have a problem with taking stuff from different areas and pushing them in one area. Just
your body is, it's systemic.
Okay, but is that like, so you're saying that this information can come to you and you can interpret that, if I understood that correctly, right? As far as the connection between this and other organs?
It doesn't need to. If you're taking an antibiotic and you're taking it orally, because you have multiple infections in your body, it is addressing that, correct? Because it's systemic. When you have several infected teeth, every time you chew, that comes out and is circulating throughout your whole body. All we're trying to find in it is what's circulating throughout your body.
It's a collective of stuff
It
that
is,
matters.
yes. The scientific world, would it be ideal that we could say this cavitation produced this and this root canal caused this? People can't afford that.
Yeah, I
I
get that.
have a one case where the 4 extraction, the 4 DNA
Yeah, I know.
separate, and there are 5 different microorganisms, and they're similar. Half of them are same, but they're slightly different.
Is that,
So they have a slightly different.
So my question is that of value? If money was not an issue in a perfect world, would that be of extra value to say that this?
I don't think so. If you're going to lecture on the difference between root canals and cavitations, maybe. But for the patient, no. And all I'm concerned is that they're able to get in the hands of someone who can give them a treatment plan that will actually work. And they need to know what they're fighting against.
Will you talk about when this information comes back to a dentist?
Yeah.
How do we?
You refer them. You are bundled. Every patient that comes in, when you start learning with me, I start teaching you the value of your patient comes in and the first thing they are signing is what MD are they working with. Because you have to be absolved of certain things. If your person has low platelets and they know that, and they come in and they have a horrible toothache, and you want to take out their tooth and their platelets are 85, that person could bleed to death. Yeah. That is not your call. But you're trained, they have a toothache, it's really bad, I can help them today. I want to put you in a safer world where there's a team. And so just hang tight.
So this is where
Let me get a sip of this tea.
I test them, either doxycycline, zithromycin, and pranidazole. Sometimes you use clindamycin. Sometimes dentists will call amoxicillin is not strong enough. Augmentin have a lot of side effects. I would recommend people to use augmentin.
I don't think the dentist should be treating it at all.
Yeah.
I think they should be in somebody's
when they
hand.
take a tooth, that's when they start taking the zithromycin, pranidazole, and either clindamycin and niacin. So I already give them ahead of time so they know to take it either night before, the same day, then for like 3 weeks at a time. These are sick people I usually.
So this next slide is actually research that Robert Jones did. Robert Jones is the creator of a piece of equipment called the Cavitat. If you knew his little story, he was diagnosed with ALS, and then he ended up having all his amalgams removed, his cavitations cleaned out, his root canals removed, and he didn't have ALS, he had dental burdens that were making his body not function correctly. He was an airline pilot and an engineer, and so he ended up trying to create something that could help us do speed of sound imaging, which is what Dr. Yu was showing you earlier. There were some flaws in the system, but he started doing research after this, and what he asked for was root canal teeth and cavitation proceeds. Now, before this research was done, the most toxic thing we knew of was mercury. Okay? What he found is that it played a part in our immune system more than we knew. P53 is known as your oncogene. It's a tumor suppressant. You don't have to know anything more than that right now. And the CDK2 controls the cell size, and the P21 controls replication rates. So let's look at what happened. 4,000 samples were taken from different dental offices throughout the country. Those teeth were washed. So it wasn't something on the outside. They wanted to make sure it was the inside of the root canal teeth that they were getting. The first sample that went in the equipment, they stopped the research totally. They called Bob and said, we have to know what we're testing because we need our scientists to be in complete zoot suits. We had to dilute the first sample by 8,000 times in order to get the computer to even register. That's how toxic it is. What in the hell did you send us? And Bob said, teeth and jawbones of humans. Really? Yeah. Okay, so 900 root canal teeth. They're tested after 3 separate washings. The toxins from the root canal teeth totally inhibited the P53 by 99%, the P21 by 68%, the CDK2 by 67%. The toxins from the cavitations inhibited all 3 by 99%. Remember I told you that, you know, before this we thought mercury was the big issue. After this we're going, holy crap, look at what dead things do inside of the body. The beta tubulin destroyed by toxins in root canals and cavitations is actually 5 times faster than it is with mercury. So I want you to consider these dental infections. The effect on the P21 was overstimulation of the cells, kind of like autoimmune links. Different links were found to ALS and MS, lupus, and Parkinson's disease. How this research changed me. If you were a young woman and it was a week away from your wedding and you were in a car accident and you broke off number 8, I would say, oh my gosh, that sucks. I'm going to send you down the street. They're going to do a root canal. They're going to put a temporary crown on there. You're going to look gorgeous for your wedding. Don't worry about it. Later, I'm going to ask you to come back and get some testing done so I can get a baseline on this tooth. If you have a problem getting pregnant, because this is on the meridian for that, come back, let me retest it, and let's see where you are. And I would leave it at that, because my belief was everybody handles different burdens differently. After this research was presented, what it proved to me is, you know how you have patients that come in and they go, oh my God, I'm MTHFR positive. Oh my God, I'm going to die. And you're going, oh my God. Just because you have a SNP does not mean that it's turned on. But okay, good that you know you have it. This is the things that you want to pay attention to. But they literally think they're going to die. Having a root canal tooth with all of this dead tissue in there that I have just now seen the research on that is worse than mercury by 5 times makes me understand that it has the potential to turn on that gene and make it a dirty gene now, which means that this woman who hasn't had a baby can now have dirty genes, get pregnant, and pass a SNP on to her child. They end up with cancer that I could have prevented by giving her different information. I'm all about giving the information. I don't want to scare somebody and have them have things taken out that don't need to come out, but I want to tell her over time, this is what I know will happen. It's going to be a personal choice. You'll either have the tooth taken out after the wedding, after the, maybe a year later, whatever. I get it. We don't want to have you swollen from surgery for your wedding pictures. You guys see where I'm coming from and how even what I have said changes? Yes.
Repeat the doctor's name again.
Oh no, it's not a doctor. Oh, which
Person. The person who's doing all the research.
okay, it's Bob Jones.
Bob Jones.
Yes, but he's not a doctor. Okay, have your patients watch my video on root canals. I have it on my personal website. It's one that just educates them. It's not as scary as root cause, but you don't want to be the one necessarily telling them all the information, because then it looks maybe one-sided. So I think it's better when patients come to me and I tell them, I have no financial gain. I don't care what you do. It's a personal decision. It's your body. You can choose wrong and always, correct it later. Taking a tooth out is a permanent decision. So I need for you to go home and pray about what you want to do. I need for you to talk to your family about it, because your family is probably going to think differently than how I think. But after you have all the information, then make a decision and move forward with that. Let's talk about amalgam. Just so that you know, 1 gram contains 1/2 gram of mercury. So if we say that the average adult has 10 fillings, that means that they have about 5 grams of mercury that are available. So I'm going to put this in a way that you can completely understand. I'm very visual. I speak in word pictures so that patients leave with concepts. If you had a 10-acre lake, that's a pretty big lake, and you have Guido throw a body in the lake that has 1/2 gram, that's not even the average for the number of amalgams in there. It warrants a fish advisory. So you should tell Guido to dispose of them someplace else and not in your 10-acre lake. Mercury is in the amalgams. So when you say a silver filling, it's not really silver because it's not the bulk of what it's made. It's silver in color, so that's how we have chosen to distinguish it. It's an amalgam. It's a mercury amalgam. When you buy cookies and sugar has the highest amount of what the ingredients are, sugar goes at the first of the list. So it is a mercury amalgam. Because you now have mercury coming off of that filling every time you chew, every time you brush, every time you drink anything hot, every time you drink anything cold that's acidic, mercury is now going to get into your body. Candida is a normal microflora that now sees a purpose to help try to prevent the mercury from going to the brain. So you get a bloom of candida. So I'm in disagreement with physicians or even a nutritionist that says, oh, I see you have candida, let's put you on a candida diet. Well, then you're interfering with God's plan, because God put that in as a compensating mechanism for the fact that this person has high levels of mercury. It also will make the cholesterol go up. So why is the person's cholesterol high? Just don't give them something to bring it down. Try to figure out why. It could be a thyroid problem and their cholesterol is high. Mercury will go to the brain, to the kidney, to the joints. It actually will go everywhere. It loves thyroid tissue. It will not show up on blood tests unless you just had mercury removed, or if you just had mercury placed, it's going to find a home. So it's a stupid way to draw blood and see if you have mercury. Remember that the mercury can pass the placental barrier, proof positive here. Dental amalgams are a 24-hour-a-day exposure. It's not like you just went and got a vaccine that had thimerosal in it. It's like every day you got a vaccine with thimerosal in it.
Can you please repeat the candida part, because I still don't understand. So are you saying that if they have mercury but they for some reason cannot remove it right now, not to put them on a candida diet?
That's my preference. That is God's protective mechanism. So I am trying to reduce mercury in other ways. If you reduce the mercury, then the candida doesn't have the need to be there at that same level. Not that I don't tell them about sugary foods and things, but it is a natural flora there that has taken this reaction because of something else that's happened. Okay. Yes, you guys heard about the SMART protocol. Research was done with both organizations, us being a smaller part, so we choose to call ours the PROTECT protocol. It is a very similar protocol. Our doctors are trained the very same way as far as the safe mercury removal, but we go as far as to say it's also about protecting your employees. It's also about protecting the planet. So me working as a hygienist, even though that first year I was drilling out mercury fillings and breathing it, then for several years I worked in a mercury dental office cleaning teeth. And so I was breathing the mercury in that office, so it was just adding to it each year. I mean, mine started off with my vaccines when I was very small, because my mom didn't know any different. And then in second grade, I started wearing contacts, and contact solution used to have thimerosal in it to help prevent bacteria growth. When my eyes turned red, the doctor put me on contact solution for sensitive eyes, which was a much smaller bottle, which only pissed my mom off because now we're having to pay more money for something. And she didn't understand that it was because there was something toxic in there. It's not that she doesn't love me. She just thought that the doctor was trying to make more money. And then in grade school, I played with mercury. And then as I'm going through the hygiene program, I don't want to get pregnant, so I'm using a contraceptive called the sponge. You get it wet, you insert it vaginally. The spermicide was mercury at that time. So I've had mercury in my eyes. I've had mercury injected into me. I've had mercury in my hoo-hoo. I have breathed mercury. So, and then I'm breathing it again, going through the dental program. Can you see that my exposure was over time? And even though I do have methylation flaws, I had no awareness. I didn't feel weird or stupid. I'm just as weird and stupid as I've always been. And so I didn't feel the difference that some patients feel when they have a methylation problem and they get the hit. Getting pregnant and having a pregnancy not hold, of course, is part of the MTHFR. We look at that, but it's a huge clue for you. Could this person be mercury toxic? Is the fetus aware that they're not conducive to life? Because I 3 times had miscarriages until my body was less toxic and could hold this pregnancy. But it wasn't until after Trevor was born and didn't meet his mile markers that the doctor said, I think it's you. I think you are mercury toxic and you gave it to him, which is a horrible thing to tell a mother, a horrible thing. But anyway, the PROTECT protocol is, you realize that any dentist can call themselves biological. I have made this my life's mission to change this, but anybody can say that they're biological and put it on our website. So when a patient calls, I actually give them a list of questions. Ask your biological receptionist if she can answer these questions, and if not, then you're not in a good office. Go to my website, and I actually have certified biological offices so that you're not getting duped. Because, again, we've gone so far as to trademark the term certified biological dentist, certified biological hygienist, certified biological assistant, receptionist. We are the only organization that trains the entire staff down to your person that answers the phone. Because if a patient who is now savvy calls your office and your receptionist goes, what? Compatibility, what? Okay, they're going to hang up. Not going to go on to your office. Removing mercury filling can be dangerous, so we want to make sure that you are in someone's hands that can do it safely. We don't want to take out something that's a known neurotoxin unless you replace it with something that's going to cause headaches, because where are you going to go? You're not going to go back to your dentist. You're going to go to a doctor and say, I've been having headaches for the last 90 days. Is he going to ask you, did you just get dental work done? No. He's going to draw blood to see if you're anemic. But when you come back and you're okay and you're not anemic, because he hasn't even drawn iron or ferritin, he's just done an incomplete panel and decided that you're not anemic, he's going to say, well, but I hear that you're having headaches every day. You could have a brain tumor. Let's do a CT and an MRI. But when that comes back good, he offers you a prescription and a Neurontin to take for the rest of your life. And that will help you so that he will be your friend. Things have to be done in a correct order, or you could end up with disastrous results. And I use all kinds of analogies here, so hopefully that gets my point across. We do cover up the patient. This is what's under how they're going to be covered up afterwards. So you have to talk to the patient so that they understand, if they're claustrophobic, that this is not going to be a pleasant experience, but it's for their protection. The staff also has to undergo all of this. It's not fun, you guys. It's not fun at all to be compromised in your breathing. All the way down to hair coverings that need to be done, what we do with the operatory, what we do with the environment. This is ultimately what the patient will look like. And so it's important that the patient have this. So I literally hand out these flyers as the patient comes in so that they understand. The worst thing for me is for them to hear that they have to have a mercury filling taken out, but think that the price is something that they can't afford, and not understand that going to Mexico and getting it done wrong or down the street could cost them way more in health problems down the road. So it's my job to make sure that they get it, and they do by the time they leave. Okay, so this is what the staff should look like while they're working on the patient. Scary. It's an occupational hazard to be removing mercury fillings, and yet in the dental schools still they don't allow any protection for the students. Not fair. Don't you want an office that pays attention to all the details? Yes, I do. So I want a dental office that answers all the questions correctly. You guys have to practice within your scope. Just like I said, when you get your results back from DNA connection and it shows that there's all these bugs and cooties that you can't even pronounce the names, they need to go to somebody else. You're not the person that's going to be handling that. Likewise, most MDs are not going to be taking out teeth. Most MDs freak out about injections in the mouth. And yet dentists freak out about, I had the worst time getting them to actually stick the needle in. Don't just sit there. I'm looking the other way. Stick it in and get it over with. But stay within your scope of practice so that you don't get in trouble. So the example I like to try to use here is if I have a kitchen countertop and it's messy like this tabletop, it would drive me crazy if this were at my office, okay, because I just can't stand mess. And I got a phone call saying my mother-in-law was coming over. I don't have time to sort through this and see what this is, so what am I going to do with it? Open the drawers or open a cabinet, I'm going to shove stuff in there. What happens over time is we become burdened. And that's what happens with a body like mine that has a methylation issue, is it looks at this, let's say mercury, and goes, oh, this is a nice screw. You just finished putting together a sling set and you had this extra screw? Oh, let's don't throw it away. We might need to use it. And it just puts it in the drawer. So I end up with all these random ass parts all over the place that are not necessarily necessary, and if the body really knew that they were toxic, was designed to discard it. But there's a glitch in the process. That's my way of describing mobilizing versus detoxing. So realize that many things, I'm going to use vitamin C as an example. Vitamin C, given IV, will move that mercury molecule from inside the cell to the extracellular space. If my body is working correctly, it will go from the extracellular space to the potty. I don't work correctly. I already told you that. I have an MTHFR flaw. Okay, I have other issues. My methylation was messed up. So when you moved that mercury from here to the extracellular space, I would feel horrible. Just horrible, because now you've just made me smell all these toxins. The cell then goes, I don't know, it's a nice screw. It was just fine in the cell. Let's put it in another drawer. So it moves it from cell to cell. That is not removing it. And so your patient feels crappy. It's going to go real slow for those people that have an issue with methylation. And you're going to have to take them slow enough so that they don't feel bad. But there's a huge difference between detoxing and mobilizing. And people will tell you all kinds of things. I have a practitioner in my area that muscle tests and goes, yep, you've got heavy metals, 24, 25, 26. 26 times in a foot bath and you're done. That'll be $2,500. What? And so when they call me, I'm going, where's the documentation? Did you do a challenge? What heavy metal was the highest? Was it lead? Was it mercury? Because all of those require different agents to draw them out of the body. And can he document that you're done when he says you're done after 26 foot baths? Just know that there are people out there that's hearts are probably, they're sitting on them. That's a nice way to say that. Okay, so how do we prep people for amalgam removal? You can check the excretory routes. If you have a license to do that, so my health people that are not dental, this is something you all can do. You can use drainage remedies. You can talk about them, about detoxing afterwards. You can explain to them that taking the mercury out of their mouth is not going to get it out of their body. I cannot tell you how many people I see that had their mercury fillings removed 10, 15 years ago, and then I'm testing them and I'm showing up with heavy metals in a kidney, and I look at them and go, what'd you do to chelate afterwards? What does that mean? Who did you see to clean your body up after you had your fillings done? I don't know, my dentist didn't do that. It wasn't the dentist's job. Oh, I didn't know I was supposed to do something else. So you need to prepare them for that. So what do you do if they cannot afford to remove the mercury out of their mouth now? So think of it this way. I have a sink that's about to overflow. I might have it here. No. Okay. I have a sink that's about to overflow. I can turn off the faucet or I can pull the drain. Pulling the drain is chelation. Turning off the faucet is removing whatever is the source, which in this case might be the mercury fillings. Okay? So if you can't stop the faucet, at least do something to try to keep them at bay. I don't like chelation while they still have mercury fillings in, but there's a lot of disagreement, and I can see both sides of that. So I'll leave it at that. There's training available. ICIM does training. And so if those of you that are interested, and I usually tell patients, go look for somebody who's ICIMED.com for the website. Wendy runs their organization. Look for somebody who is actually trained, because you would be shocked what people think is chelation. And again, they have no documentation on the front side or the back. It's horrible. But when I say open the excretory routes, I mean measure their kidney point, their liver, their lymph, their large intestine, their lung. That's the way, those are the doors and windows the body chooses to throw stuff out. You can respire it out. You can poop it out. So your lymphatics are designed to go through and scavenge the blood. Use homeopathic remedies in order to get those readings so that they're better energetically. I tell people that trying to detox and not getting those pathways open is very similar to you going home and trying to clean a bedroom and get all the dust bunnies out from under the bed. But while you're doing that, I am hammering the doors and windows closed. You just moved junk around in the room. You didn't remove it because you can't. I disabled that. I do want you to think teeth. Every time you see a person, you should think teeth. Think about what teeth they had taken out. Think about, ask them in your questionnaire. Ask them if they have silver fillings. Ask them if they have root canals. You'd be shocked how many people don't know. I don't have a clue. Really? And then you look at the Panorex and see that they're a mess. They have no idea where stuff is. Okay, so now we're going to get into some meat. This is where we get down to actual testing and more of the how-to do this. And again, my opinion, my way. When I learned this, you did not have to wear gloves. And it wasn't until Andreas Marx, which I don't even know where he was on the list as far as the number of places that I'd been to get trained. Andreas was really big about insisting you wear a glove. And I had just gotten out of wet finger dentistry, which sounds really gross, doesn't it? I mean, when I got into dentistry and when I got into paramedicine, you didn't wear gloves at all. So I had people, I had fingers in their mouth, and then I'd wash my hands and then go to the next person and same fingers in their mouth. Gross. And then I'd go work on the ambulance and I had blood and guts everywhere, and then AIDS came out and we started wearing gloves. So you had to relearn how to start IVs and everything because your senses are changed. But I didn't want to have to wear gloves for EAV. What I saw was if you pick up, and I always demonstrate this when I'm, like, even on my online classes now, take the bar and have the patient hold it. Now you're going to hold their hand like you're going to test a point on their hand, but instead of touching them, touch you and you'll get a reading. And it's audible, you'll hear it. Put the gloves on, do the same thing, there's no reading. Why? Because you're taken out of the link. It just so happened that what sent me over the edge was I was at a conference, and it was an oncologist, Vincent Speckhart. I don't know if you know Vincent. Okay, Vincent was lecturing about his data with EAV and how a person that you're testing, if you have a problem, can come up with that reading. And I went, what? Well, just before he started lecturing, the chiropractor next to me, who started on this journey kind of at the same time, said, Dawn, do you always show up that patients have a thyroid problem? No. Well, then you're doing it wrong. Let me show you what you need to do. And being new at this, I said, oh, okay, I'll try it your way now. And then as we're lecturing, he's going, let me explain this to you. If a patient comes in the room and I test them and it shows up with oat cell carcinoma, but it doesn't show up as a really strong frequency like in an X, it maybe shows up in an M. For those of you that are eclectic, it means it's, you know, out in the atmosphere. It hasn't manifested into true disease yet. I will ask the person, where have you been? Oh, I spent the weekend, my mom is dying of lung cancer. Oh, what kind does she have? Oat cell. So you picked up some of her energy, but it's way out here. It's not manifested in the true. But if you're testing somebody and you have a physical problem, your auras blend. The only way to prevent that is wearing gloves. And,
Any gloves?
you know, gloves that will prevent electricity from not going through. So yes, now if you get our nitrile gloves wet, you will start to see electricity come through. So you want to keep your gloves dry.
What if a cotton glove?
Cotton gloves, sure, as long as it's not wet. Yeah.
But that doesn't prevent it. Only rubber can.
No, the cotton, anything that's a barrier will prevent. So then my question became, well, when I was doing muscle testing, your hand was sometimes on the skin of a person. So it made me change how I would talk to people about muscle testing. I think it's important that there's some kind of a barrier to prevent what we can prevent from bleed over. Because then I looked over at the chiropractor and went, you have a thyroid problem? I have Hashimoto's. I went, okay, now I'm not going to listen to you about I'm wrong. It's probably this. So I went back and I started wearing gloves, and it's amazing what kind of difference. I don't like wearing gloves. I hate it. But I can see that my readings became truer, and that when I was in surgery, it made a difference. They don't stop until I hit 50, 50, 50 over and over again, and I couldn't do that when I had me and the link. So it's a way to take you out of the link. Tips for testing. I always ask people if they have batteries on, like if they have a watch that has a battery, take it off. Cell phones, take them off of their person. Some women wear crystals in their bra. I don't know why. Some people wear diodes. Other people have magnets. I've got a chiropractor who sends all his patients out with a mark magnet, and they have to wear it in their underwear. And so I always have to ask on his patients, you have a mark magnet on, take it off. It's not that they'll explode, but you are not going to get true readings. So you want to know what they are sitting like this, not the improved version. Okay. Try to have them not cross their legs. Do you know that you cross your legs as a way for your body to heal itself? It's basically like laying on of hands. What does a woman do when she has cramps? She puts her hand where it hurts. She puts the energy that she can give to the area that needs energy. When you cross your legs, it's one side that's deficient trying to help the other side out. I just want them to put their feet on the ground, and I want to test them like that. So it's little things like this that will help you get truer readings. I choose to moisten a 2x2 and place it around the hand mass, and then I moisten another 2x2, and I use that to wet my point so that there's not drippy all over the place. I don't like spraying. It gets water everywhere. I need you to check for polarity. When you learn to do muscle testing, this is one of the first things that they teach. Why wouldn't we think it important in EAV as well? Polarity, in this side of the hemisphere, things go in a clockwise motion. Go flush the toilet and watch it. The water goes in a clockwise motion. Pull a drain, water goes in a clockwise motion. Go down to Australia, it goes in a counterclockwise motion. If your body is in harmony with the Earth's magnetics, then your energy should be going in a clockwise motion. Things like cell phones, electrical wires, sleeping under electric blankets can make your body go into what we call left spin. And then your answers are not true. So when you do muscle testing, don't you want to get a strong when I say my name is Dawn Ewing because my name is Dawn Ewing? And if I said my name was Mickey Mouse and I stayed strong, I would not know which is a yes and which is a no. It's the same thing in EAV. This was something that was taught many years ago, and then somehow, some way, people just decided it was just not important. Let's just jump right to it. You do know there are people who just do muscle testing, and they just say, put your arm out. Okay, do you need this? Oh, it's still weak. Okay, what about this one? Oh, you're strong. That's it. They didn't go through any of the preliminary stuff, and yet they're trying to tell a patient that that's the readings. I'm just trying to tell you how you can get more confidence about what your reading is, because I remember when I started this in the beginning, and I would touch and I would get a 60, and then I'd touch again and I'd get a 32, and then I'd touch again and I'd get an 80, and I'd go, oh my God, which of those is right? Probably none of them, because you haven't developed your tactile ability to know how much pressure. That is the biggest flaw with EAV. That gadget takes all of that away. It is, it connects into the box. It's piston driven. All you have to do is put it over the point that you want to test, and it comes down at the correct amount of pressure, and it gives a reading. So what's cool is if you get the equipment, and they've done this before, take people, teach you how to use a regular probe, and their readings are all over the place. Turn them onto that and leave them go for about 5 minutes, and then take their readings, and their readings are consistent. And then what's cool is take a different person learning and put them on that, and their readings will be, each practitioner, the same or very similar. That's pretty cool. The hardest part about learning this technology is taking the readings. That is the hardest part. So when we're looking at polarity, what we're going to have the person do, and I've got some good pictures for you to see. They're going to hold the bar in one hand. They're going to extend their index finger. They're going to find 2 inches above their own belly button and touch, which is in about the 3rd chakra. And then you're going to touch their large intestine point on the other side. If they're over 60 or you hear a whine, wah, 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 then that's bad. If they're anything under 60, they're good. Got me? This is what it looks like. Patient holding the brass bar, extending their index finger, touching 2 inches above the belly button. Me, with gloves on, touching their large intestine control measuring point. If it's over 60 or whines, that's not good. So if it's not good, they're not testable. My yeses aren't yeses, my noes aren't noes. It's just a bunch of garbage. You need to be able to do this and not look at the screen, because you can influence a person's reading. If you take a reading and then you look at the screen, you'll see the reading dip. So you should get used to not looking at the screen. Or put the screen where you can see it and the hand here, and not have the patient look at the screen, because some of the stuff that shows up on the screen, I don't want the patient to see anyway. If you ended up in left spin, then you want to correct it. There are some simple things that you can do. You can have them rub around their umbilicus in a clockwise motion. You can have them do cross crawls. Do y'all know what those are? Okay, cross crawls. See, Thelma and Louise, my new hips. Okay, you go like this. And then you have them retest and see if it reset. Or you could place a remedy on the tray, and there are lots of remedies that you could place on the tray. One of them would be Viscum album at 1M, which is mistletoe. The most common thing I see is that the staff of the dental office took an x-ray and did not offer the patient a homeopathic remedy for x-ray, and therefore they're temporarily in left spin. And so I would ask the person, did they give you some little pellets under your tongue after they took that Panorex? Huh? Ugh. It's important to me that a lead apron get used, but it's equally as important to me that a homeopathic remedy get used. So I do teach a lot about that. But this is things you can put on the tray.
What homeopathic remedy do they use?
Borean makes one. It's X-ray at 30C. And you just give 2 or 3 pellets. There's no magic in it being 5. There's no magic in 3. You just want to make sure that it got some on the little pellets that are going in. And then just put it under their tongue. You retest, and if they are no longer over 60 with the drop and they've come down, you've reestablished them into correct spin.
So it's called X-ray 30C.
When you do a CBCT, you cannot put a drape on it because of, so how do you?
You can, but it's got to be lower. It can't have a thyroid shield on it. They cannot have a thyroid shield on it.
So if it's you know, stuck.
Right, and there are certain people where you just can't. I get it. Then you have to lay it across them if you have one that are seated, or you have to try to put it on them with Velcro, which we've tried before. And what you're trying to protect, I get it, a thyroid, but what you're trying to protect is, all your organs for reproduction, or if the woman is pregnant and doesn't know it. So you still want to protect that individual.
Because they've told us, like, don't use one because it's going to interfere.
From here up, yes. And, there are long-necked people and there are no-necked people. Being in EMS, when you're trying to intubate somebody that has no neck is horrible. They're like this, and you're going, oh my God, I don't even know how I'm going to get this picture. Okay, so please educate the people about what EMF can do to them. Maybe have a Gauss meter, talk to them about cell phones. I'm going to do a thermography lecture about how thermography in dental in July at the dental festival, and I have a really good thing on cell phones where I did some thermography and showed some cool stuff. But 60 cycle interference is real. In EMS, when someone would code, which means that they stopped breathing and their heart stopped, and they were in their kitchen, and I'm trying to connect them to an EKG and see if there's a rhythm, how I would appropriately give drugs, and the refrigerator came on, you go into 60 cycle interference, and all you see on the screen is you have no idea what's going on. So I'm not a very big person. I would have to have the firemen, who always joined the paramedics on a call, drag this person's butt into another room away from the refrigerator. My point in saying that is, if it's affecting this person enough that it's affecting my ability to see how their heart is beating, think what it's doing to a child who's maybe sleeping on the backside of a refrigerator. You ever think about that? When I was going through Capital University and I was sitting there waiting for my advisor to talk to me about my thesis work, which my thesis for that was my son's finger, and documenting that. He was documenting a fish, and I'm listening to him going, this is such crock. They really have lowered their standards. But as I listened more, it became very interesting. He bought a fish at Walmart. They got it home. They floated the fish in the bag. They opened it up. The fish dies. So he scoops it out, puts it in a different bag, goes back to Walmart angry. They give him another fish. He comes home, floats it, it dies. Now he's really angry, gets the fish, puts it in a Ziploc bag, goes back and talks to the manager. You have sick fish. And he says, oh, okay, calm down. Did he tell you that you have to walk the fish out like this? No. He said, well, the fish come in through the back where we don't have theft detectors. And the fish seem to be sensitive to the EMF. And so if you'll just let me get you another fish and you'll walk it out with your hand over your head, I think you'll have good results. So it made him think, wait, my wife comes home, she hits the remote control, the door goes up. EMF doesn't have a stopping point. It goes and it goes all around like this. So if you're sleeping above this refrigerator, on the back side or the sides of this refrigerator, you're getting nuked with something, this EMF. He gets his fish home, it lives. Now he's doing his thesis work and he's talking about things like the remote control. I was the remote control when I was little. My dad would say, Dawn, get up, change the channel. And I would walk from the sofa to the TV set and manually change the channel. But now they have remote controls. What if someone's standing behind you shooting the remote control? There is an energy that is moving through there. And for some people, that affects them. I don't want you to freak out and think that you're in a toxic world, which you are, but 60 cycle interference is a real thing that can affect your readings.
So the fish was affected by
The EMF of the theft detector. As you go out, you know, the thing that goes beep, 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 beep. If you're stealing something, not that you're stealing a fish, but. Okay, so if you're trying to take readings and you're next to a refrigerator and that refrigerator cycles on, you might have an issue with your readings. Just trying to work out some of the kinks. So when you're working with teeth, you don't have to know all the points that Simon knows. That's good news for dentists. All we have to know is LY2 and LY3 and some allergy points, and we'll be able to do our business. So we don't have to know all those points on the toes, and we don't have to take people's shoes off and socks off and work with stinky feet. We leave that to you medical people. If there's a fall, it means that there's an indicator drop. I call these whiners to the patient because that's what it sounds like. Wah, 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 wah. These little whiners. Ideal is 0. You don't want there to be a drop at all. It is a sign of degeneration. It means that the cells are stealing the electricity as it enters the body, and that the body is starving enough that it's actually stealing them. So let's discuss what this is, and that's what I wanted this for. If you ever see my reports, which sometimes when I present, I show patients' reports and they're doodled all over. The reason that I do that is because once I had a patient leave and say, she did this testing on me and she didn't say anything at all. I thought, I'm either going to buy a tape recorder, because I spent an hour with that person explaining all kinds of stuff, and that made me so angry. So I thought, no, Dawn, what you're going to do is you're going to take the report, you're going to print it out, and then you're going to doodle on it, and you're going to explain everything, and then you're going to make copies of it afterwards, and one goes to the dentist, one goes to the MD or whoever was referring, one goes to them, and that way, how did that doodle get there? Yeah. Okay, so let's say this is a healthy, happy cell. We homeschooled, so you're going to get my homeschool lecture. When I touch this point to test the tooth, Electricity goes in here, and it is checking top teeth. When I touch here to check a tooth, the electricity goes in here and is checking the bottom jaw. Okay, so they get that. They are holding on to the bar with the finger extended, touching a tooth. The question is, how much electricity goes from where I touch and put it in, and do you touch on the other end? If I have a straw and I pour a cup of water in the straw, I expect to see a cup of water on the other side of the straw. If not, and it's just a drip, either somebody has a kink in the straw or there's something in the straw blocking it. Y'all are doing the same thing, you're just not doing it with water. So this healthy, happy cell has 2 candy bars in his hand. He can't wait to go home and eat his candy bars. They're actually electrons, but it's more fun if they're candy bars. Okay, there is these guys in your body. Everybody has these guys, everybody. Nobody's immune. Infection, heavy metals, chemicals, air pollution, all kinds of stuff. He also has 2 hands, but he only has 1 candy bar. His sole purpose in life is to see some kid with 2 and go over there and steal 1 from him. That is the dumbest down version of oxidation that I can give you. That is rust in a car. It's wilting in a flower. It's aging in a person. So what do we take to combat this oxidation? Antioxidants. I'm a magic person coming into your body with a tray of electron candy bars, and I am looking for kids with only 1 hand full. And I run over there and try to give 1 to them before they steal 1 from somebody else. That's an antioxidant. Following me? Your patients hear these words, but nobody's ever explained it to them before. So by the time they leave, they're going, oh my God, I know stuff at a whole bigger level. Now I understand why I'm taking my A and E and C, and I'm going to start taking it better. Okay, so my individual that only has 1 candy bar, he also has another name. It's hard to write sideways. Okay, free radical. If I have a reading on 2 areas, because I deal with teeth, I'm going to say 2 teeth, and both teeth measure a 30. My goal is 50. I put 50 electrons in. I want to get 50 electrons out. I'll take 48 to 52, but anything outside of that range, I want to know what's going on. So a reading of 30 is low. 2 teeth have measured 30, but 1 tooth measured 30 and went wah, 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 wah. A drop trumps everything. It means that that's the body's way of going, me, 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 me. I really need help over here, please. I'm the one that's the problem child. If you'll take care of me. So when you look at my reports and you're a new dentist and I'm trying to train you on how to read this, you're looking at this and you're overwhelmed, which is why quite often what Simon said is true. The protocol is we want to take out all the mercury fillings first, because our concept is we don't want mercury vapor in the mouth while we're opening up a jaw, so that there's not mercury in the jaw. We don't know if that cavitation surgery is going to heal, and we don't want to have to go back and redo it. So that's why we designed the protocol that way. But if we've got information that says that's all good and well, but the person's not breathing, it becomes more important that the person is breathing than that they get the mercury fillings taken out. So this helps you distinguish where that starting point is, okay? So the drops are super important. The energy can be blocked at either end, which is what we were talking about earlier. You will see people have symmetrical dental work. You will see they have symmetrical decay. Those are the individuals that probably it was the other end of the body that started the weakness for those teeth to even get decay in the first place. What's important is you can have a poor reading. I'm just going to use tooth number 8 as an example. It could be a dental issue, but it could be an ovarian cyst. It could be that the person has a kidney or a bladder infection. It could be that they have uterine fibroids. You see how it can be both ends? You have to think of a circuit. And so when I'm talking to patients, I try to explain to them about a circuit in their home. If I'm cooking and the stove and the oven work, but the dishwasher and the garbage disposal don't, I know I have power coming to the house because some of the appliances work. I can check the breaker, but if it hasn't tripped, that's all I know about electricity. I'm going to have to call an electrician out. The electrician uses an ohm meter and says, yeah, you got power coming from your breaker box. to the first 3 outlets, but from the 4th on, it's disconnected. Lady, here's what I think happened. A mouse got in your wall, which is going to freak me out. No mouse in my house. And he nibbled a hole in the wiring, and that's where the disconnect is. That is what you are doing. You're trying to determine where is the electrical disconnect in this entire circuit. What we want is a closed circuit. That's a good thing. What we don't want is an open circuit. So now, what happens when you taxidermy a tooth and you take out the wiring? The tooth is still there. Think of my lamp. I took out an inch of the wiring, but the rubber cord is still there. I didn't cut that apart. I have created an open circuit. It's so important that these dental places get evaluated. The root canals, implants, which we'll talk about, and cavitations. Those can all create an open circuit. So can areas like a non-vital tooth, a tooth that did its own root canal, a deciduous tooth. Yes?
Have you had a chance to test zirconia implant?
Oh yeah, we're going to get to that. Good question. So how to balance a point? You have a point that does not measure between 48 and 52. Now you want to know what's going on. You're going to find a substance. What I did for dentistry is I took all the things that were dental and I put them in a library. So basically what happens is you have a tooth that's not good, you can turn on this library and find out, is it a dental problem? If it didn't make it go to 50, you go over to the other end of the meridian, and I've got everything in for that tooth, so you turn it on for all the things for tooth number 8, the kidney, the bladder, the prostate, the ovary, the anal canal, and if that goes to 50, send them out the door, it's not a dental problem, they go to the physician. I've tried to make it as easy as possible so that more people would start using it. You have to remember that first you are taking readings, and it's like taking a temperature. They can be too high, they can be too low, they can be just right. And if they're too high or too low, yes, we would like to try to figure out why. The thermometer, if it registers 102, does not tell me that I have a fever. I have to distinguish, did this person just take something hot out of their mouth, like they just took a sip of hot coffee and then they put the thermometer in their mouth, it's going to make an artificial reading, or did they just get out of a sauna and that's why their body temperature is so high? Please, please don't think that this is a magic 8 ball and that it can diagnose. If it's too cold, did the person just have ice cream? Were they outside in the snow? Did they just run a marathon, which, believe it or not, will make it too cold? It's like tuning a piano. So when I say that, I mean that when a piano is out of tune, it doesn't have a disease. So you have to get out of your mindset that when you're testing these points, I've got to find the disease. Because you're not. You're just taking temperature readings on all these points, on all these teeth. If that piano is not in tune, it could be that the string got loose or it's tightened too much. And it doesn't stay in tune forever. If anybody's ever had a piano, if you frickin' move it, you have to get it retuned. And if the temperature becomes real humid, you have to get it retuned. I don't have a piano anymore because I'm tired of getting my piano retuned. Actually, it's an excuse for me to not have to play the piano. You want to think of your patients as the pianos. So you're taking a reading today at a moment in time. It is repeatable, which is what I like about EAV versus like a Zyto, or you hear about people who will do biofeedback, where they put their hand in a tray and it tells them everything that's wrong with them. No, it's a random number generator and it's not reproducible. If I get that there's a dental problem, I better be able to get that dental problem is showing up over and over and over again until the dental problem is taken away. And when you do biofeedback, the way the biofeedback is designed is it recognizes that there's a deficiency someplace and sends energy there, so when you redo the test, it comes out better. But you didn't really heal the person. You see what I'm saying? So it is not in surgery, I cannot use biofeedback. I have to have something that actually takes a reading that is reproducible and that doesn't change unless we have changed something in the mix. So you can't use biofeedback. It's much easier to do biofeedback. But again, it's just a random generator. Most people have parasites, so parasites are going to pop up. And these people come into you with the readout. This is all the things wrong with me. I don't pay that any mind. It's great for stress. Yes, work on that for stress. So think of your patients as pianos with piano strings. It really takes the practitioner to look at that information and see what's going on. If you've got a reading on a liver point that is off, it could be that they just took Tylenol. I was asked to work a booth, which I don't usually do, but I worked a booth for this company, I don't know, 15 years ago, because the guy had gallbladder surgery, emergency, and it was in my hometown. Okay, great. So I went there, and it was a bunch of chiropractors. And this was the second day of the meeting, and so I was checking different points on different people, and I checked a couple of liver points, and they were sky high crazy, but they'd had a killer party the night before. So a bunch of them, it was alcohol, but some of them, it was that they were taking Tylenol. I try not to get that deep, but there are things that can change that particular point reading. It could be that the liver enzymes are high, or this person has had chemo and they've like maxed out on their chemo and their liver just cannot take anymore. It could be that they have a blocked bile duct. It could be that they have a tooth problem on an eye tooth, which has to do with the liver. Eye tooth? Wait a minute. Where did that saying come from? Eye tooth. I didn't make it up. I heard about it many years ago. Do you know that your cuspid is on your eye meridian? Isn't that interesting? And yet, I didn't learn that in any school that I went to. A tooth is the very same. So the tooth can have a bad reading, and it can be the tooth, which is a dental problem, and it could be a myriad of things. I have been doing this so long that I can even get information about, okay, sometimes it's just a bite issue, TMJ. It's more a chronic issue. In the very beginning, I had one dentist that every time I get chronic pulpitis, she wanted to take the tooth out. I said, no, we're going to help this tooth along. We're going to do some things to try to save it. But it does mean that something's been going on for quite some time. It could be an organ at the other end that has been crappy for a really long time, or it could be that this person is grinding on this tooth. So how does the body know what will bring it to 50? Because you have a reading that is not good, and now you're trying to find something that is coming out from the computer, or that you're doing to the body, or that you have as far as physical, like these little vials. The question that I want to ask you is, how does the glass, who doesn't have a brain, know exactly when to shatter, when the opera singer sings the note that resonates with that glass and makes it? There is no to it, but it is all based on frequency, which is not anything that we have learned in traditional world. You're going frequency. This is all frequency medicine. Okay, that's bunk medicine. Frequencies can elicit responses. And frequencies are in everything. My husband and I can walk into a restaurant, and if our favorite song is being played, we'll hold each other's hand, lean over, and give each other a peck. And you guys don't even know music is being played, because it's not eliciting a response for you, but it is eliciting a response for me. A baby can cry. That is not your baby, but you're breastfeeding. What will happen? That's a frequency being emitted that is eliciting an unwanted response. But it is very real, and you can't change it, right? So I'm going to open your mind to the concept of frequency medicine, because that's what you're dealing with. It's a law of vibration, that everything has a unique frequency, everything. I was so traditionally trained that this was the hardest thing for me to grasp until they actually put stuff in front of an oscilloscope, because I could understand the oscilloscope. It creates a sine wave pattern. And they would put something on there like an apple, and they'd print out the frequency, and then they would remove it and put a banana on there, and it would be a different frequency, and then they'd take it off and put a different color apple. It was very similar to the first one, but not exactly the same. Everything has its own unique frequency. My voice has a frequency. I can tell you information about how to get somewhere and put it on a recorder and have you listen to it. That shows how old I am. I could put it on something on your phone and you could listen to it, and it would direct you about where you need to go. Red light lasers have frequencies that tell our cells to do things, which is why we use the red light frequencies. When we're talking about the hertz, and now you're getting into the red lights and things, the frequency is determined by the time in between the two peaks. Every substance has its own unique frequency. Do you see that middle line? That's where we're going to look at maybe homeostasis. And so I'm going to tell you something that helped me understand. That middle line is not true, it's a Dawnism. Every time the frequency passes through that middle line, you get $1. Okay? I'm going to tell you that nosodes, things that are sick, diseases, they have a very slow frequency. So in this line, it's the blue one. I didn't earn very much money, did I? But can you see the red one? It went through the center line more often. I'm going to end up with more money. That's healthy tissues, anything that vibrates at a healthy. So let's talk about somebody who's upbeat. You have people that you're drawn to because you feel energized when you're around them. And you have patients that you see their name on the schedule and you go, oh, shit, I just want to go home because that person is so draining of me. So that's a frequency, and you're actually experiencing that. When you're dealing with all these people that have gotten into Young Living, and they swear that the oils can heal everything. Oils vibrate at a very high frequency, like this. So if you're getting $1 every time it goes through, you got a lot of money to play with. And if you're talking about recharging the body, that is part of the reason that they can make these claims. They're not anecdotal. They really are getting something from. Same thing with music. You know, I don't like to listen to rap. I would like to pull over and shoot the car. Literally, it makes me that angry. I just can't stand it. But other music, you know, my husband proposed to me at a Christian rock concert, and there's a particular song that I could be in the worst mood ever, and you put that song on, and after 2 or 3 minutes, I'm in a completely different place. But I have not taken an antidepressant or anything else. I just listen to music. So it's the frequency. This is what I was talking about with the frequencies and how quickly they go through. They actually create patterns. If you take frequencies, and you can go online and see this, there's really cool videos where they put sand on a tray and they change the hertz and look at the different patterns that sand makes by doing nothing more than changing the frequency. And so my point in trying to get you to here is, what if I told you a banana looked like the star? And what if I told you vitamin A looked like the X? And what if I told you that a virus looked like the X with all the hashtags all over its place? But now, as we're trying to find something that balances this point, I tell you that the only thing the body is looking for is anything with an X in it, which is why you might get something different than you get, than I get. So it's super frustrating when you're learning to do this, and you have 4 practitioners, and they're going hamburger, vitamin C, banana, and I'm going dental. Which is why I took a lot of the things out for the dentist, because I just need them to stay in their lane and take away everything else. When we're talking about resonating, that is when you automatically have some intuitive decision that you're walking into church. You always sit on the front row because that's where I sit, but there's somebody sitting in your spot. Now sometimes I will choose to sit next to them. Other times I get the heebie-jeebies. I don't know why I don't like them, but I'm not going to sit there. I'm going to sit behind them, or I'm going to sit on another row, but I just have picked up this resonance. You've heard people say, I resonate with that. Those are yuppies that say that, you know, because I didn't really understand that until I got into this. If I take a tuning fork and I hit it, and this tuning fork is the same pitch, I can bring them close together without touching, and this one will start to vibrate. Again, cool videos online, go look up stuff like that. You are trying to send a signal to your patient from your equipment to get them to act like the second tuning fork. You're trying to find out what frequency resonates with this point on their body. Are you sure you're following me? As I'm trying to give you some word pictures. Again, for those of you that are like me that go, yeah, this is just kind of way out there, I don't know. Again, got some PubMed stuff for you that I threw on here. Oh, sorry. Okay, there's the first one. There's the second one. So I'm basically asking the body, can I get a G? And if the body wants a G. It doesn't really care what octave it is. Most people understand what I'm talking about on a piano or different octaves, a low G or a high G. It doesn't matter if it's coming from a violin or a piano. It just thinking wants the G. The G does not say it's cancer or arthritis or Lyme disease. It just needs the G to get back in balance to be able to make the body work like it was designed by God to do. Okay, I see good faces. If I went to the store and I purchased flour and tomatoes and garlic and onions and oil and basil and oregano and cheese, I could make a bunch of different things out of that. If you found all of those things balanced this person, you cannot be absolutely sure that that person was going to make pizza with those. Maybe they were going to make lasagna, which would be my examples for different diseases, which is why I tell people, don't let the person see what's on your screen. Because if they see Borrelia and they're smart enough to know that that's found with Lyme, you just opened yourself up. So I don't like for them to see that. Many diseases and problems have similar frequencies, just like the grocery list, which is why I just choose not to say that. I find something that will fix it and I tell them, I'm going to help get you directed to somebody who can take care of that. So if you run a scan on somebody, meaning you check all the points, and in order to restore balance to that person and get 50 to show up, maybe papaya shows up. Okay. But papaya could mean that what that person needs is vitamin C, because papaya has vitamin C in it. It might mean that the person needs the papain to break down the protein because they're deficient in hydrochloric acid. It's just a piece of the puzzle, which is why Simon says, when I keep getting dental and I keep sending him back to the dentist, you know, I'm just trying to take the information that I have and say, please, let's try to work this out as a team and see if we can figure out what's going on. Because there isn't a slam dunk on this. Everybody knows that the majority of your body is water, and so I found this really cool video. If you go online, you'll see it's water coming out of this hose, and it is going at a spiral, like a ribbon would be going like this at a particular frequency. Then they change the hertz to show you that it actually makes the water look like it's going back in the hose. It's super cool, but it's so that you could understand that the water that's in your body is actually reacting to the homeopathic remedy or the frequency. So when we're using Meridian Stress Assessment EAV for compatibility, it's important that I explain to you it's not the same as IgG or IgE. How do you explain my reaction to not wanting to sit next to the person in church? Not having an allergic reaction to that person? How do you explain the fact that I love this piece of jewelry? I adore this piece of jewelry. I actually made this slide when I was in hygiene school because we had to learn to make crowns, and our professor knew that we weren't going to do that for a living, so he taught us how to make jewelry, and then we made crowns. So I have, you know, kind of an attachment. But I don't feel the best when I wear it. When I get home, the first thing I do is pop it off and lay it on the counter. I'm not allergic to it. It's just doing something to me. You will hear people that will wear a watch and the watch stops. How's that happen? But somehow they're in competition with each other energetically. And that is what we're looking at when we're testing these people. Same thing with applied kinesiology. The disadvantage with applied kinesiology is you can only get a yes or no. I end up with a number value. What's my perfect number? 50. So I would like to start with a number that's 50. If it takes it too far outside of the range, I don't want to use that. But I end up with a number. So if it shows up with 49, no, that's not perfect, but it's really close. So I'm going to use things in that window that are closer to 50 than the things that are further away. Where, again, in muscle testing, you can't do that. To determine the most acceptable materials, that number value that we assign lets you judge whether something is a perfect match, near perfect, or just okay. Whereas you can't do that with muscle testing. Okay, the first thing I tell patients is nothing that we use is as good as what God gave you. And I have people that call all the time, what's the most compatible composite? The one the person is not allergic to. No, I want to know what kind of composite material should I buy? I'm setting up my practice. The ones the person is not allergic to. I can't stress that enough. It's like saying I want to make a salad and I don't want anybody to be allergic to it. Well, guess what? Somebody's going to be allergic to something or reactive to something that's in there. You want to opt for the healthier materials, which is why we try to choose. But even in dentistry, you know, we thought that, well, when we found out that mercury was toxic and we then believed what we were told in dental school, which was it's not going to come out of the amalgam, but now we believed that it was actually coming out. We said, okay, well, what can we use? Let's just use composites. Many of those composites had BPA. Well, it's not a fair trade-off to take out something that's a neurotoxic and then end up with the person having a glioblastoma because of the BPA. So we like to use things that are the safest for that individual, and we would like for them to outlive them. Talked to somebody earlier about the allergy testing, and we were. She was saying she does who did I talk to at lunch? Who sat next to me at lunch? Yes, you. Thank you. Okay, this is EAV compared to RAS testing. So you can do allergy testing for foods, other things. I just do it on dental stuff. But there are plenty of people who do it on foods and then do NAET to try to get the person to be able to be okay with something that they're reactive to. Yes?
Your favorite labs?
Labs for?
For
there's only two. I mean, you have Clifford, which is now not Clifford. Somebody else bought it out and just reopened it, and your Biocomp. ELISA. Okay, you have to have an informed consent. Yes?
Bioallergy testing or NAET for allergy elimination. There are some people out there who believe it to be unethical. I would actually go there because you're turning your body's reaction off. You're not to the alarm. It's an alarm that you're getting. It's your body's talking to you saying, hey, don't eat this. And people say, you know, oh, my kid's allergic to milk, and then I had them, you know, had it turned off. Well, now he can drink a gallon a day. I don't know if that's a good thing.
Okay, but let's put it in the perspective of a person was in a horrible car accident and they have a titanium rod and they're reactive to nickel. So using NAET could help their body deal with the fact that they have no other option. They can't take that rod out.
Correct. There's a time and a place for
yes, I agree with you. So, my point was just that there's plenty of white papers out there about using this technology for allergy testing.
What does NAT stands for?
Nabudropod's allergy elimination technique. Okay. The informed consent that you have should say what you are and what you are not. And it should say a little bit about the testing. So that's my informed consent. My informed consent tells them, you know, these are the things that I am, these are the things that I am, but Texas could give a rat's ass about. So even though I am that, it's like saying I'm an MD from Columbia. I have no license to practice medicine here, so I choose not to do that, but I have the knowledge. It basically says if I find something, you're going to get referred somewhere. And then when down at the bottom, when it's talking about the allergy testing, it says you do have a choice for allergy testing, which are the below. And the way I'm going to choose to do it today is using EAV, and that way the person is understanding what it is they're having tested. All kinds of things can make you sick. The disadvantage to dental work is you're stuck with it. It's a 24-hour-a-day exposure, just like the rod in the leg that I just talked about. But, you know, oftentimes in dentistry, we use things. I had somebody tell me, oh, I don't do compatibility testing because everything I use is organic. Oh my God, just name one product that you use that's organic. Just one. Well, I don't order it, my assistant does. No. Text your assistant and tell me, just one. I'm just looking for one. There's nothing organic that we have in dentistry. Nothing. So we have to look at everything that we do, everything, and we have to piece things together. So some of the fillings that we use are glass ionomers. Some of them are plastics. Some of them are ceramics. Those all require a different glue. I have to explain to the patient, we don't use Gorilla Glue, which would bond anything to your tooth, in dentistry. So each of those items has something that will hold it to the tooth. We have to make sure that you're okay with the filling material and you're okay with the bonding or the cement that way you want to use. If you're not okay with the bonding or cement, you can't have this filling material. We have to find another one. So we're looking for perfect matches so that nothing we do in dentistry in a biological world will upset your homeostasis. So we're measuring a point. Yes?
I think another piece that's overlooked is the curing times and the light.
Oh, yes.
That has to match the both bonding agent and the material.
When I ask someone to send me a sample, it has to be cured, because the frequency of something that's not cured is completely different, and they might be okay with it one way, but not, and you have to cure it. So don't give it to me unless it's cured. That's a whole nother topic, but okay. First, you want to look at the allergy meridian. You would like to choose a point that's on the allergy meridian, because the allergy meridian crisscrosses more surface area on the body than any other meridian. So it's a better reflector of how this product is going to react to you. If you can't find one, then you can go to a nerve point, or if you've got a patient that has MS or ALS and you really want to know if this product is going to affect nerve, then you could use a nerve point. In a pinch, you could use organ degeneration. I try to make it simple as simple can be, so we're going to start with the allergy points. There is a couple of allergy points on the outside of your lower digit, and there is an Otley point right here that we can use. We're looking for something that's the closest to 50. That's Otley's point. You want to place a focus on a person. Do you have to use a focus? No, you do not have to, but I have it right here. Okay, so the purpose of a focus. There are a lot of noises in this room. If you got me to shut up for a minute, you could hear an air conditioner on. You might be able to hear a bird outside. You might be able to hear a car. A lot of extraneous noises. If we're standing on the corner of a street in New York City, and I'm talking to you on my cell phone, telling you where I am, please come pick me up. You may or may not be able to hear me because of all the people and the hustle and bustle and the sounds of the city and the traffic and horns and somebody screaming, hey! If I went to a very soundproof telephone booth, some of you might not even know what that telephone booth is, and you got inside and now used your cell phone, you would hear clearer directions from me. Does that make sense? Mm-hmm. The focus, all it does is take whatever the computer frequency is at that moment and sending it closer to the individual. So you just hook it on them. And now you're testing them, making sure that you're not testing anything else, that you're really getting a clean signal. Every blue moon, I'll have somebody that is not testable because they're too close to something. I used to have my remedies in a certain area, and I ended up moving my entire office around in a different configuration because I ended up with a couple people that they were too close to the remedies to be able to get clean readings from them. So I want them, and you're not going to be able to build a Faraday cage to have them in a perfect environment, so you do the best you can. But do you have to have this? No, you don't. But it is available for you to get much cleaner readings, and you're not supposed to throw it around.
Question.
Mm-hmm.
How is this different from using, say, a grounding mat?
No, it's sending a frequency out. It's actually sending the frequency closer to me than this frequency coming out from the box. Okay, there's music coming out very low, and I can't hear the song. I don't know what song is playing. Now I put an earbud in, and I can hear the music really well. I know exactly what song it is because I can hear it because the music is so close to my eardrum. That is emitting whatever frequency you're outputting from here. It's not a canceling. No, it's actually sending the signal closer to you so you can get a reading.
Amplifying.
But isn't your body supposed to be the one that, oh no, because we're giving a signal when it's passing. Okay, now I get it.
Okay.
Sorry.
It's okay. That's the focus. So when you select an item from the list in your computer, if you have a computer, is outputting a signal from the box. And the person should be sitting in a special place from the box so that they can pick up the signal. You got me? Like the music that I was just talking about. You don't have to do that. You could use actual substances. So if somebody says, I had this denture made and I want to know if I'm allergic to it. I don't know what their denture was made out of. But I can use the denture. I can take a reading on them with their denture out. I can now have them put the denture in, or I can have them put a denture in their lap, or they can hold the denture in their hand, as long as it's in their field. And now I take a reading, and it is checking their body reaction to that particular denture. Follow me? Okay. You can use these little things. So if you want to make your own dental test kit, you can get glass vials and put different substances in each thing. It's a nightmare because if you're like me, you take a vial out and you don't put it in the right place and then you can't find it when you want it. And in the computer, it's always alphabetized or however you set it up. So you can put things on the test tray. I could use, like the glass vials, and have corn in it, is the example I have here. But it could be dental material, specific flexite. Could have a piece of flexite in there, and I'm checking it. I don't have to have a computer. You don't have to have a computer. I'm not a salesperson for the computers. It just makes your life easier if you're really going to get into this. That's the tray. So whatever you're putting on the tray is now in the circuit. It's the same thing as if I'd stuck it in my aura or put it in my hand. It's just that I don't want the person to know what I'm testing, so I can put it on the tray and then test them so that there's no influence.
So same thing with all the dental materials you're talking about, flexite or bond. Do you have to cure them in order for you to test them?
Yeah, because that's the way you're going to have it in the patient's
You put
mouth.
the bond in a glass and cure it inside the glass, and then now you got that energy.
And the glass does not confine the energy.
It changes the composition.
Yeah.
Properly plastic.
How does this compare to, like, at the beginning of the lecture, you're talking about the Russians, the strawberry? And like,
That's what we're getting. That's exactly what we're into right now. Exactly what we're into. So you're going to start off by taking a baseline point. You want the baseline point to be 50 because 50 electrons go in, 50 electrons come out. Everybody knows 50 is perfect. That's the number you're looking for, 50. If I can find a 50 and on 1 or 2 points that are on the allergy meridian, great, then I can do my entire list based on that. If you have 2, that's good because sometimes the point will become fatigued because some of my lists are 120 items, and if you're pushing 120 times, yes, I give them a break, but still, it can get fatiguing. If that reading goes up or down by more than 5, they're not okay with that material. It's similar to pulse testing. You do pulse testing a full minute, and then you subject the person to the material, and if the pulse goes up or down by 10, then it's not okay, but we're doing this with electricity.
You mean the little curve that goes up and
The reading, the actual reading. When you end up with a number at the end, you'll see.
so it goes up, but then it drops down.
Don't worry about the curve. Don't worry about the curve.
What do you mean going up or down then? Above?
I took a baseline reading that was 50, and now I'm taking a whole nother reading on that same point, but now there's a material in the circuitry, and if that reading is 44, not okay. 48, yes, they can use that material. And the advantage is it logs it. So before, I had to take a vial, put it on the tray, take the reading, take it off, put it back in the thing, write down the reading, take the next item, put it on there. So it's very time consuming, and if you talk to me, I got befuddled. With the computer, I just go bam, 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 bam. It logs everything, prints it out.
So 45 to 55 is good?
Yeah, I would rather it be tighter, but 45, you're, you know.
You're in there.
Yeah.
So if their baseline is not 50, then.
And we'll cover that. Again, y'all are asking great questions. They're for the more advanced. I'm just trying to give you some basic technology right now. So you're going to evaluate the readings. Again, I teach the dental offices. Everything that's 50 is something you can use, but you got a window of okay here. And the way I set up the computer is basically, if it comes out green, you can use it. So I try to make it stupid proof. If you're looking at a material and it has a green line, use it. If it's yellow or red, don't use it. And you have the opportunity to do that, but only if you have a system. So where are you going to get the materials? Well, you could obtain them from the different labs and from what you order, and you can make a test kit. You have to have a sample of absolutely everything, and they do have to be cured if they are curable items. You don't have to have the actual substance. If you want a dental material that is not already in our library, you can send it to me and I will put it in there, which is jumping through hoops for me to do because we basically have to translate it and I don't do the work. But I can get that in there. I've got 1,000 or so in there already, but only the biological materials are in here. You can create a box like this for your dental office, or if you're a dental office and you're going to send it to an MD, then you could create a test kit. They would list out all those materials and they'll put a check, it's okay, or scratch it out if it's not there. Not going to put numbers because if they're doing muscle testing, all they get is a yes or no. You could create a sheet like that which would just have, from somebody doing muscle testing. Again, EAV has so many benefits. This is adding it into the virtual library, which means that then the computer assigns a square wave to it. It's a good opportunity. Some computer systems use hololinguistics. I don't do that. So the system that I work with actually sends out a frequency that is the frequency for that material. It's the difference between doing muscle testing and actually having me hold vitamin C versus doing muscle testing where the practitioner says, do you need vitamin C? I put that out to the universe, and there's a signature to that verbiage, but it is not the same to me in my head. And I'm the one doing the testing. So there are pieces of equipment that use hololinguistics for everything that they do. You're not really outputting anything but a word on the screen. And there are systems that actually put out a frequency. Every time a word comes up on my system, a frequency is coming out of this box. That's what my computer looks like, which I'll turn on in a minute so that you can actually see it. And it's running through the list. Now, the list has been assigned numbers. Do you see that there are numbers? Right before each of the product names, there's a number. Right in that column right there. And you can click on it then and make it do all kinds of fancy things and print it. That's a printed report. You see it's green, it's good, you could use it. It's yellow or red, please don't use it. You couldn't get easier. You just couldn't. That's a close-up of it. So I've got one that's red here. You will see people that come in that have like mast cell. Oh yeah, they do not tolerate anything. And I don't ask for anything about their history, and I'm going, what's the matter? This is a really clean list that this dentist has, and every dentist has their own list, and you're kicking out items left and right. Oh, well, you told me not to tell you anything, but I have mast cell activation, and I'm in the middle of got issues right now. And I'm going, yeah, okay. So, I mean, ideal is that I work with them while they're at their sickest, because I don't want a dentist to put something in that then when they are sick, they're kicking out. So I tell them, I want you to come in when you're sick and let me see. And if we don't have anything, then we're probably going to find a temporary material and take you out of stuff and get you healthier by seeing the doctor, and then we'll put you in more permanent dental work later. So what's compatible? Anything that does not go up or down by 5 and does not have an indicator drop, a whine. Wah, 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 wah. Remember that a stressed reading is anything that's over 5 or below 5 from what your original drop was. So, if you have a food that produces an indicator drop or is higher or lower than 4, then the therapy would be to avoid those foods or rotate them every 4 days. You can't do that on a dental material. So we might find something like a phenolic that would help you, or you could end up seeing somebody with NAET. An example would be you have a crown that there's nothing really wrong with the crown other than you're not really doing well with the material. If we can find a way to desensitize you to that, okay, that would be an option. Interesting, when y'all were talking about blood pressure, I had a patient that came in once with a brand new gold crown. Blood pressure spiked. Now hypertensive, never was before. The referring physician wanted the tooth removed. And in my testing, and this is in my early days, so I was just really fearful. I ended up calling the MD and said, I don't even know what I'm doing. I'm sure you're going to tell me I'm stupid. I'm using EAV. I would like to ask the dentist to pop off the gold crown instead of taking out the tooth. And we popped off the gold crown. Blood pressure problems went away. It was on a lower molar, which has to do with arteries and veins, and sometimes gold can be very stimulating. I don't know. Can a person become compatible with things later? Yes, they can. I mean, if they have a really high level of candida and they're super sick and their immune system can't handle anything but lettuce, well, then as they get well, they're probably going to be better. Can it go the other way? It can. If you're testing somebody who doesn't have cancer and they come back 5 years later and their immune system is completely crashed, yeah, they might not be able to tolerate some things. So that part's easy, and I always start people out, if you do anything with me, that's where we'll start, is getting you to be able to do allergy testing, because you have to use the point reading over and over and over again so you get pretty proficient at it. It's the easiest thing for me to teach, where you can actually start making money in your practice using the equipment. Again, I don't think the dentist should be the one doing it. I think it should be somebody else, but that's up to y'all. So now if we're looking at evaluating a cavitation site, did that answer your question about strawberries?
Actually, no.
Okay.
My question was, or the point that I got from the strawberry thing was that that person had never been exposed to it before.
Mhm.
So if you're introducing
Oh,
a denture to a patient and now they're developing a resistance.
Okay, so when I first started doing this testing, again, the very conventional side of me said, if I do this test and I'm good at doing it, I should pick up everything that is showing up on the blood test, right? That was my mindset. I picked up a gajillion things more. And I went, oh no, I must be doing something wrong. I'm so sure I'm doing something wrong. And it wasn't until I was sitting with somebody else who said, no, what you're picking up is what they pick up in muscle testing. It's the energetics, that your body does not like it. So why would you even give it to this person? Error in the favor of the person. So when you're doing EAV, it is not an IgG or an IgE. You are not testing antibodies. You are testing the body's reaction. It's like asking, do I like rap music or do I like oldies? And you subject me to it and then figure out that I don't like the rap music. That is not an IgG or an IgE. There's no antibody. It's an energetic response.
So they don't develop a sensitivity to it in the same way, like an energetic sensitivity to
If
it.
you gave it to them, they probably would, but they haven't had it yet.
But the ones that are okay for them right now.
So if I knew that you were going to have a reaction to strawberries and I tested here and I got strawberries, I'd probably never give you a strawberry because you won't have a reaction the first time. Your body's deciding. And then the second time you have the strawberry is when you really have your reaction because you have the antibodies. Okay, so we're looking at cavitation sites. There's no tooth there. Maybe a tooth has been taken out. Maybe there was no tooth there at all. That the body didn't have enough energy on that meridian to nurture a bud and it died on the vine. Could be. So I always tell people to do a temporal tap because your body has compensating mechanisms. Somebody's driving down the road and flips you off. Your body is designed to create your blood pressure to stay in a certain window. So it's supposed to make your blood vessels dilate so that you don't have a stroke because of this nerd that just cut you off and flipped you off. Those compensating mechanisms are going on at all times. So if you do this, it kind of scrambles the brain and says, hey, in case you're doing something to make everything okay, I just want to get a true reading on what's going on here. You have the bar on the opposite side from where you're actually testing. You'll have them extend their finger and touch that area. And then you are touching on either the LY2 or the LY3, depending on the side that you want to test. It's on that side, and whether it's maxillary or mandibular area. You're looking for high or low readings. You're looking for that indicator drop, and you be prepared. Sometimes you'll find an area that is a pan focus, which means that that area disturbs things outside of its meridian. Then you're going to try to balance the point to find out, is that cavitation a problem because there's actually a void there that has bacteria in it and dead bone, or is that area there because there was a bud that never did develop because this person has a congenital heart problem. And the heart was not allowing enough energy to come through to this cavitation area now. These are things that I use to balance. So I just have dropped them in the library that I created in this system. I use a custom library that I made just because it makes things faster for me, so why would I not want to do that? When you're testing a tooth, pops up where you can test the tooth like this. I have the person actually touch the tooth. If the person doesn't have a hand, I mean, you get creative and you can stimulate that area and then test. During surgery, we do it a different way. This is my husband who's helping out and is disgruntled that I used his pictures against his wishes, but too bad. So I'm testing on the upper right side. The patient is holding the bar in their left hand, and then they're touching the tooth. And then because it's maxillary, I'm using LY3 on the right hand because I am testing the right side. Same thing on the bottom, but now I'm using LY2. Does that make sense? Everybody tracking? This is all spelled out. Again, I'm just exposing you to it. Same thing when I'm testing the left, but now I had to have him move the bar to his other hand, so his bar is held in the right hand while he's testing the left. Okay, then when I have my teeth, I have a library to go to. I have frequencies. Every time one of those words is highlighted, that frequency is coming out. But because it's so time consuming to go one at a time, I can actually hit a key and have it send out all those frequencies, like having a jukebox and saying, all these records, do you like these? Is there something in there that makes you happy? And I can look through the titles and go, yeah, I like that song, I like this song. It just makes it go faster. Now you see that I've gone from dental no-sodes. Let's go back to this one. This one was dental no-sodes. Everything's in that list, then it goes on and on. Then I have a shorter one. It's just for a crown tooth.
I had a question about the previous slide. When you're checking a particular tooth and you're touching the lip, doesn't that kind of...
Well, yeah, but you're sending electricity through the tooth, too.
Okay, so it does...
And I get very specific at times where there's a tooth missing, or if I get a wonky reading, I might make them move it to a different area.
Just thinking like they're touching, the lip.
You can't help it.
Oh.
You just can't help it. Okay, so then I tried to make it easier. So this is a crown tooth. So these are the major things that affect a crown tooth. If it's a dental problem, here's things that affect an extraction site. If it's a dental problem, here's things that affect root canal. If it's a root canal and you're testing and it has a bad reading, if it's the tooth and it's a dental problem, then something in here is going to balance that. If it's a sensitive tooth, they're having pain, then I have a library for that. Do you see how I've tried to make it easier and not have as much time? So now, if none of those things balanced it, you touched the tooth, it had a bad reading, it's not a dental problem. It's the other end of the meridian. So what I've done is I've created a library here of all the things, but I've made it even easier because you can open this up, and this is for tooth 1, 16, 17, and 32. Those are the organs that are associated with it. So now you can go through individually, or you can block it out and send it all out at one time. I teach people that don't have licenses, if this shows up, it's out of your hands. Now you're going to refer to the MD. If it's a dentist and you're in the dental environment, great, then your dentist can handle it. But if not, then you're going to refer them out. Here's for the molars on top and for the bicuspids on the bottom. Here's for the bicuspids on top and the molars on the bottom. Then you have your eye teeth, and then you have your anterior teeth. It's just that simple. I really have tried to make it as easy as possible. If it's the organ, you can either work to heal it or refer it out. You want to use common sense. You can use homeopathic remedies. If you are in a dental setting, other than that, send them out. Please send them out. If the reading is, let's say, less than 50, then that's an area that you want to focus on. You're going to output a frequency to them. If it brings it up closer to 50, I'm a perfectionist, so I really want to get it to 50 if I can. If I brought it up to 48, I could stop. But I want as much information as possible. In the beginning, did I do that? No. But after you've been doing this for several years, you'll start perfecting your skills. I'm not expecting that you're where I am. The beauty in this is, let's say I find a tooth that is a problem and it says it's the thyroid. And when I'm investigating it because it's my patient. It's not a dental issue. So I'm going to investigate it. I, by chance, put in mercury. And mercury brings it up to 48. I can output mercury a second time. It brings it to 49. I can output mercury a third time. It's like taking 3 boxes that are filled with mercury, or 3 ampules of mercury. It's a way to weight it to see how toxic they are, so that when you're cleaning them up, the goal is that they shouldn't be 3 anymore, they should be 2, they should be 1, then they should be none. You have the advantage to be able to go in and do that, but that's not what I'm going to teach you in the beginning. If you have tooth number 32, which is a wisdom tooth area down on the lower right, and it has a baseline reading of 40. Everybody knows that's not good, right? Thank you. I'm telling you that it takes kieferostitis. Kieferostitis is a homeopathic remedy that basically means there's dead bone. Times 3 means I had to put it in 3 times, 3 ampules of kieferostitis in order to bring it to a perfect 50. It is a way to wait. For me, when I do that, anything less than times 3, okay, they can use ozone, they could use proteolytic enzymes, they could do something to encourage building of new blood vessels in there. If it's times 3 or higher, they have to do surgery in order to clear that burden. And that's just based on my stuff and what I was doing with Bill. So a lot of this, when I say it's my stuff, it is my stuff. I don't know who else weights it this way. Pre-surgical,
When you say times 2, you have to actually use 3.
I'm outputting it, I'm outputting it, putting it a hold tank, outputting a second signal of the same thing, doing it again. It would be the same as taking one box, placing it in my field. I'm a little stronger. Now I take a second box, pile it on top. I'm a little stronger, take a third box, and now I'm so strong you could hang off of my arm.
So the program actually contains those frequencies.
Yes, it does.
Okay.
Yes. Pre-surgical, so you could prepare your patient for surgery. You could get their lymph moving. You could use aconite, which is for fear. You could use arnica, which is to prepare the body for trauma, and it's really good post-surgically. You could use Bach flower remedies because, again, they cycle very quickly like the oils do, and you get amazing results from these thinking flowers. With surgery, it requires that you take a reading that is repeatable. This is not for a beginner. This is not where I jump in. When people say, I just want to learn how to do this, I'm sorry, I'm not your person. Because I don't know that you can even take a reading that is a correct reading. So you have to start from the beginning. A dentist doesn't learn how to do crowns and extractions before they've learned how to do anything else. I'm sorry, it's boring stuff, but you have to start at the beginning. When you're using EAV, and I think I already went through this with y'all, yeah, those are some homeopathic remedies. When you're taking our certification, I try to keep the homeopathy part just for dentistry because I don't want you to get in trouble by using things that you should have no awareness of. Do get reports. Please, please send off everything that you take out. I can't tell you how many times I've been involved with things where because we had backup to verify, even if it's doing the DNA testing, but you know, if you send it off and it comes back with something like this. In the case that I was telling you about where the PSA was 760 on the root canal, we did send that tooth off, and it came back that the materials had gone beyond the end of the apex, and so there was foreign material in the jaw. Well, that bode well for us because now we have more of a reason to have taken this tooth out. It was a poorly done root canal of this perfectly healthy dead something. Anyway.
The place that you recommend sending besides Dr. Bucco because I think he's retired.
Yeah, but I think UT still does it.
Yeah.
I mean, he's actually moved. He's not even in Houston anymore. He went back to West Virginia. And so, you know, then keep the results of your surgery, which I do. Now, there's another thing, just a little pearl. You can do a hand-to-hand, a hand-to-foot, and a foot-to-foot, which means that you have 2 hand masses. Your units usually come with 2 hand masses. One will be, like for children, it's just a little smaller diameter, and then a bigger one. And then you touch one of the hand masses. Normal would be 82 to 86. If it's above 86, then there could be a problem. So you can check hand to hand, and you can see what side it's on. You can see if it's above the umbilicus or below. I just wanted to throw something else interesting in here. So to recap, so that we can move on, you can do compatibility and test dental materials. It's going to be different than your blood testing, but it is something you can do in the office, not only to generate income. Maybe you want to set your assistant up and have it be a separate business from your dental practice. I don't know, I don't care. If you don't want to do it, maybe you're going to send it to a practitioner like a chiropractor that does muscle testing, or someone like a naturopath that does EAV, and they do the testing for you. It is not testing IgG and IgE. You will get those things that they're allergic to, but you'll get an entire list of other things. You can test dental burdens. You can test during surgery to see if your reading finally goes to 50 so that you know that you've gotten all the dead bone out. You can create autosodes, which means that I don't like to call this imprinting. Imprinting is what happens when one of my birds is hatched little and thinks that I'm its mommy. It is recording. So you will get in trouble for saying imprinting. That is not a legal thing to do. You can record, right? We all record things, even on video stuff. You can record the flip of a bad thing and make the body be able to work it out. So the way I try to describe it is, if I'm a motorboat and I weigh 500 pounds and I'm going in the water at 50 miles an hour, I'm going to create a unique wake for how much I weigh and the speed that I'm going. If a motorboat weighing the same come in the exact opposite direction at the same speed, where those wakes come together, they will cancel out the frequencies and you'll see clear water. That is what you're trying to do when you make an autosode. It means that you are taking funky stuff, whether it's snot or goobers from the inside of an extraction site, and you're trying to create a customized homeopathic for that person. I don't have to know if there's actinomyces. I don't care. I'm letting the equipment make a homeopathic remedy that if they break it, I can't remake. So I tell them, you know, this is what you're going to do with it, this is how you're going to take it. But you can do that with your equipment. And you can prepare the patient for amalgam removal and detox afterwards if you're not a dentist. If you're a dentist, you're not doing this. If you're a dentist, you're networking with somebody who's your really good friend that is the one doing this. But you can use your systems for that. If you want to learn more, I have lots of cool articles in all kinds of places. That's on my website if you go to drdawn.net. If you ever need to reach me, of course now I have a new frickin' email that I can't even remember because the IBDM is going through Zoho changes. But my personal email is drdawn@drdawn.net. It's DRDAWN @DRDAWN.net. Couldn't be easier if you tried. And if you've got questions, that's where you're going to contact me. If you come to Houston, usually when I do a meeting in Houston, and it's just a few people, I try to keep it close to home. And just like Dr. Yu has something at his house, well, I have something at mine. But most people have not been exposed to parrots before, so it's a unique time for them to get to see all my buddies and listen to them talk to each other, which is crazy. Now, do y'all have any questions?
The last comment you made about recording, you said dentists cannot do this?
Oh, no, dentists can do that. You can record. You can't imprint. You can record. Yeah, and people call it different things. I've had people say that it's prayer drops. I don't care. I don't care what you call it as long as you don't say imprinting.
You just imprinting the you're just
You're recording. You're recording information into water. You know.
and then you're
Yes, and when we get really more in depth of this, I take the time to explain to you what it is you're doing so that you understand the concept. But I can't here. I just can't get you to where I am in such a short time frame. Yes.
Regarding the test kits,
Yes.
if you're able to do all that stuff with all the material that you said, like you can check things like in a section like tooth number 1, 16, 17, 32, or whatever that you were talking about, like in sections. So some of your materials that are in the library, they can be tested without actually having the vials.
Yeah, yeah. Let me show you. I'm going to turn this on. I have both programs on here, but I'm going to open up the one that is just dental.
So my question, do we really need the vials to test?
No.
No.
No. It's only if you're doing muscle testing or if you have a very basic unit like that, then you need a vial. You need something.
Yeah, I know. It's already.
Does your database work with other devices other than this one? No? Okay.
Program.
So it's only for this? Yeah.
And I used to teach the bioenergetics at Capital University, so almost every company sent me stuff. And I would get to get a feel for it. Really, the only reason I changed from Computron was because I could not get, when it went down, I couldn't get backup support. I've only had this system go down once. I asked the patient, where the cord comes in, patients sometimes set it down like this, and so it disconnected, and they overnighted one to me. I was like, oh, wow, that's cool. Other than that, they've been the only one that's ever interested in the fact that I'm doing dental applications to it. So we're going to open a new visit, and I'm just going to pick a person here, and let's say...
What is the name of your machine?
This is a bioscan, and it's through IHT. Don't ask me hard questions about the software and stuff. The other thing that I do like about this company is Frank is really open, so and he does most of their software stuff, and so if I go, oh, I really wish that it would do this, oh, write it down, I'll make it happen. And he does. So I mean, there have been so many changes through the years just because somebody's said, I wish it did this.
And do they do like software updates
Oh yeah.
yearly? Or
Oh, no. It's all the time.
All the
There's,
time, gotcha.
yeah. Okay, so I put this person in, and this system prompts me to do a polarity check, because that's how important it is that you do a polarity check. Remember earlier when we were talking about doing this? So there's no other system out there that takes you right to this point to remind you, oh, duh, it's supposed to do the polarity check. So it logs those for you. Once you get that reading, it jumps over to the other one. If you're going to be doing allergy testing, because sometimes people come in, that's all they want is, I'm here to have compatibility testing from Dr. whatever. And if they go, I just heard that I could have compatibility testing and I want to get it done. I'm sorry, I won't see you. My husband is the one that schedules all my appointments, and he knows what questions to ask. Each dental office has their own list of materials. I am not going to check 16,000 materials on you. Each office has about a list of 100 or so. You need to decide what dentist you're going to go to before you're having me doing allergy testing, or you're going to be paying me to do different allergy testing for another dentist's materials. So don't waste your money. But once you're ready to do the allergy testing, then it prompts you through checking some points for allergies. And once you have that reading and you've decided this point is now 50, now I can go into my custom library, and these are all the items that you can see the list over here. This is Dr. Scott's list. These are all the materials that she uses in her office. There has to be a make go down sound. There we go. Okay, this is Dr. Francis's list. Those are all his materials. This is, so you can see each dentist has their own thing. You can set this up however you want. So you create out of the master library of the 1,000, and if there's not something in there and you want it, then you just coordinate with me and I will make that happen, because it's an advantage to all of us in the dental world that are using this. You create a list that is custom for you, for the items that you use in your office. Okay, so one of the questions that usually comes up is implants. So while I'm on compatibility, often people kick out the titanium because of the nickel. Titanium is like sticking a fork in an electric socket and bending it around and sticking it in the bottom part. What would happen to that electrical circuit? I could short it out. That is often what happens when we find a dental burden, and unfortunately that means taking out the implant. That's a bummer. Okay, so porcelain is non-conductive. If I had, there's this gadget that you can buy and put on a metal lamp, and if you put it on any part of the metal and you touch any part of the metal, the lamp will come on, touch it again, the lamp will go off. Do you know what I'm talking about? If you take that gadget and move it to the porcelain vase, you can touch it all day long because it's not going to come on or go off, because porcelain is non-conductive. But the implant companies that want to sell you porcelain implants will tell you that placing a porcelain implant, every time you chew, you're stimulating the meridian. Bear with me for a minute. My lamp that we cut earlier, I plugged it back in and it's not lighting. I take my metal fork and I make it touch both parts of the wire. I'm probably going to see the light bulb come on and maybe blow, but it did conduct, correct? Mm-hmm. Now I take a porcelain plate and I put it in between the wires. The wires are on both sides of the plate, and I hit it to make sure that I have a really good connection. Do you see my light bulb come on? No. So it is a blockage of energy. Now, is that horrible? Is the person going to die? Maybe not, but you have taken something away from them. So a dentist, I'm going to use this as a really good example because this is true. I had a patient that had 12 missing teeth, didn't have dental insurance. Now she has dental insurance, so she goes to a dentist who wants to place 12 implants, and she finds out the price, $5,000 a piece. She's in overload. Oh my gosh, I'm not believing this. And he says, well, calm down. I'm getting ready to take a course, and it's down in Costa Rica, and you could be my patient, and I would just charge you $2,500 a piece if you pay your airfare and your hotel and your food. Well, she thought that was a good deal. In my mind, I'm going, oh, hell no. If I'm going to be somebody's guinea pig, it better be for free, and they better be putting me up at the Ritz and really good food. But I didn't say anything. So I don't ask anything about their health. I just did the testing. The practitioner that sent her in, I know better. I don't say anything. I don't even draw on their paperwork. I just send them back to that practitioner because I've gotten my head bitten off before for trying to educate a person, so I just didn't say anything. Goes back to see the practitioner. The practitioner says, if you had come to see me first, I would have told you you could have had 3 implants. And I would have selected where those implants went. But now that you've had 12 done, you have to have 4 taken out, because 8 of them are all on the same meridian and there's only 8 teeth and you've blocked them all. And that is the area you are sick. When she came back from Costa Rica, she started having problems. She got in touch with a friend who put her in touch with a functional doctor, but it took 3 months to get an appointment. It's not like you can get an appointment the next week. And so now she's finding this out. So she comes back to me angry. You have got to be kidding me. This person wants me to take 4 out. So now I had to take the time to explain, you have disconnected 100% of the energy going through here. This person is just trying to see if you can even make it with 50%. And we don't even know that you can. So a dentist is trained to place an implant, and they're also trained that function of how the teeth come together is everything, and that your teeth domino is everything. But they actually don't have the right to decide if that implant can even go in that part of your body, because a meridian is involved. They don't know anything about your blood work or about your health. They should be networking with somebody that is calling the shots. So in this case, it would be Simon saying, wow, you have 12 teeth taken out. These are the 3 areas in your body for right now that don't seem to be showing too many struggles. And each of these 3 are on a totally different meridian, so you're only giving it 25 or so of the amount of energy going through. We'll have to talk about these others later when we get you a little healthier.